Today on
Doomed!
everyone's talking about ivermectin. But what is ivermectin? And why has it become such a controversial topic? Even on where this show streams, people have been get banned from discussing ivermectin on YouTube, or not banned, but their videos have been taken down. So what's going on here? Why are doctors prescribing ivermectin? Well, some doctors prescribing ivermectin. Why are other doctors, a lot of doctors, saying, hold on, ivermectin? And why has this all ended up with anti-vaxxers and vaccine skeptics going out and buying horse paste at feed stores? We're going to discuss all of this, make it all make sense, break it all down so you're walking away and you know what ivermectin is, what's going on in terms of COVID-19 and ivermectin, and you'll have it all set, no problem. And we'll only be dealing with factual stuff here, no misinformation, no fake news. You know how this show rolls. And to discuss ivermectin, I have a great guest, and let me bring us both up on the screen now. Because honestly, you can't talk about this unless you're talking to a medical professional. And I have a medical professional with us right here, right now today. Dr. Eric Osgood. He is an internal medicine doctor out of New Jersey. He's board certified in internal medicine. He's primarily a doctor who is a medicine doctor at hospitals, but also works with COVID-19 long haulers. Those are people who've got COVID-19, have got through it, are now no longer, they're no longer sick with COVID, but they're still dealing with lasting symptoms. And it's, we'll talk a little bit about that too, because I think that's a fascinating thing going on with people who have basically got through COVID-19, but are still dealing with the ramifications of it. Dr. Oz, can I call you Eric or Dr. Osgood? What do you prefer?
Eric, definitely Eric.
Perfect. Eric, thank you so much for joining me today.
No, I'm happy to be here. I'm a big fan of yours, as I told you.
I really appreciate that. Thank you. So, I honestly, when I reached out to you, I was thinking to myself, all right, how do we go about this? Because I know, how do I go about this? Where do you start? Because there is a lot of news here. Actually, you yourself have made a little bit of news because you were originally, and we'll get into this more a little bit later, but I want to bring this up top. You were originally with a group called the Frontline COVID-19 Critical Care Alliance, FLCCC, who were sort of heralded at the beginning of the pandemic for coming up with, interesting ways to deal with, to tackle people, not tackle people, but tackle COVID-19 and people who are sick with it. And now they've become a very controversial group because, primarily it seems because of ivermectin. But before we get too into that, what is going on here? Why has this become so controversial? What is ivermectin?
Yeah, so I'm hearing myself in the background as an echo. You're not hearing anything.
I'm not.
Funky,
You sound
though, right?
great on my
good
end.
On your end.
Yes.
All right, I'll just power through it then. So all right, it's a little bit. I would not have assumed that this would be a gigantic culture war, like this medicine that's been around for a really long time that is being investigated as a potential therapeutic for COVID-19, I guess. But in today's world, in the way that everything becomes the subject of culture wars, I guess I shouldn't be surprised. But how do we get to the point where people, rather than going and getting a life-saving, incredibly safe, effective vaccine that you can walk into and get in any retail pharmacy for free, that is proving to keep you out of the hospital, out of the morgue, and forego that, and then instead go to a tractor supply store or a feed store or a veterinary supply store and ingest horse medicine or sheep or dog medicine or whatever it is that people are doing. And there's that on the one extreme. And then there's people who are just basically saying, there's no possible way that this could work. This is a drug to kill worms. Why would anybody be stupid enough to think that it would kill a virus? And somewhere in the middle of that is an actual story that's based on science, medicine, and research that I think is a worthwhile conversation to have. I also think it's a worthwhile conversation because it's really it serves as a lesson in how things can get out of hand, how the over promotion and speaking with a degree of certainty that's not commensurate with the amount of scientific evidence you have can be the fuel for a lot of misinformation and for people to make very poor choices for their health and well-being. And the fact that there is a very sophisticated, well-formed anti-vaccine movement out there that is ready to pounce upon and infiltrate and utilize anything they can to exert their influence and get people to steer away from vaccines. And it turns out that the concept of quote unquote early treatment or medical prophylaxis or medicine that you take that might, keyword might, be able to offset disease severity or risk of COVID, to use that as some kind of promotion that they're lying to you and we don't really need vaccines and it's all a big pharma scam to push vaccines, and how they will push that message and how it becomes co-opted and incredibly dangerous. So the way this whole thing started is that the drug ivermectin, it is very much a human medicine. It has traditionally been very much a non-controversial medicine. It's been around for around 40 years. It's a known, very effective antiparasitic. It's really transformed the face of global human health in a lot of the developing world by eradicating diseases like African river blindness and other parasitic diseases. It's used off-label, meaning it is non-FDA approved to treat scabies and lice. And in fact, it's basically any residential setting like a nursing home, a prison, anything like that. One person in that facility gets scabies. Standard operating procedures, they exposure prophylax everybody with ivermectin. Note, it's not FDA approved for that condition. The World Health Organization gave its approval based on around 6 randomized trials. And so how do we get to the idea that it might do something in COVID-19?
Right.
So dating back to around 2012, virologists have actually been very interested in the antiviral properties of this drug. A lot of medicines go far beyond their original intended purposes, and this is a medicine that, at least in a laboratory setting, is very well known to have a broad spectrum antiviral activity against RNA and DNA viruses through a number of pathways. It is apparently what we've seen in the lab is that it inhibits the formation of a protein that brings viruses into a nucleus. There is some computer modeling, what we call in silico studies, that suggest that the ivermectin molecule might bind really tightly to the SARS-CoV-2 spike protein. So it was thought maybe that will translate into some antiviral effect. And a number of others, inhibition of like RNA-dependent RNA polymerase and others that it's known to do. I don't want to get too, sciencey here.
Right.
And then there's a number of what we call host-directed mechanisms of action. So ivermectin is known to be a pretty powerful anti-inflammatory drug and what we call an immunomodulatory drug. So irrespective of its ability to actually do anything against a virus or pathogen, it's actually known to be pretty good at calming down the immune system when it's overactive. So it's used topically to treat rosacea, things like that. And so very early on, some virologists at Monash University in Melbourne, Australia, a very prestigious institute of virology, started doing experiments and kind of looking at different candidate drugs that might be possibly utilized to try to fight the COVID-19 pandemic. And what they found was that when they used what are called Vero-H slam cells, which come from monkey kidneys. They're a very commonly used cell line to test medicines and viruses. And they found that when they infected these monkey kidney cells with the SARS-CoV-2 virus, they were able to eradicate 99% of it within 48 hours using ivermectin. However, the concentration of ivermectin they had to use to exert that antiviral effect was massive and way beyond what you'd ever be able to achieve with orally tolerable doses because of the bioavailability, how much actually builds up. And so you had this big split in the kind of medical scientific community where it's like, there's no way this is going to work. In another group that said, well, wait a second, like what happens in a test tube doesn't necessarily translate into what's going to happen in clinical practice. And it's probably worth looking into this further. And it's known to be a safe drug. And so human trials started, different types of observational studies, some randomized studies all around the world started kicking off. And one thing that happened that was interesting that's undergone a lot of criticism is that a lot of South American countries, they just started like mass distributing this medicine to a bunch of people, just hoping to stave off the pandemic based on little to no human evidence. What you have to understand is that
I had actually first heard about it from use in India. where they were basically depending on it in India as well. I'm sure it's the same sort of situation when you have, countries with mass populations in underdeveloped areas without, the means to really treat it properly, but they do have access to ivermectin, and they do know that everything you just said about there's possibilities there. So, when worse comes to worse and you got nothing else, seems like something you would, if you're a doctor in one of those countries, find yourself be forced to experiment with.
Yeah, more or less. And I mean, here we think of this drug and it's kind of a little bit foreign and exotic to us. We don't know much about it. It seems kind of weird. In a lot of countries in the world, though, they use this medicine pretty frequently. It's really no big deal. There's a lot of endemic parasites, and it's just like people got to take ivermectin from time to time. And so it would almost be like if we saw some limited studies that showed, hey, maybe if you take ibuprofen, maybe it'll fend off COVID, people would probably be trying it, even if there wasn't great evidence. And I mean, the safety profile is comparable, if not better, actually, for ivermectin when used properly under medical supervision. Never veterinary products in self-directed use, buying medicines on the black market. You have no idea what you're getting. That's bad news. Another sort of basic science principle was they were actually testing what happened when rodents, like hamsters, for example, were infected with SARS-CoV-2, and these poor little hamsters lost their sense of smell, and they gave them ivermectin, and they actually found that the ivermectin-treated hamsters got their sense of smell back. Actually, the males more than the females, and it had nothing to do with antiviral properties. It had no effect on the virus, but it dampened what we call interferon responses. And so it was more of like, this may be doing something on the immune system. All right. So there you had this kind of like basic science basis for this medicine that may turn out to do something, may not. And, people tried to track the results and, do these studies to look at what happens when they mass distribute these drugs. And, there were some graphs that were put out that suggested that there were decreases in case counts and COVID hospitalizations and deaths after these distribution campaigns. But there have been some criticisms raised of those because there's a lot of potential confounding factors. And there are a lot of other things that could have been, related, and waves go up and down. It's hard to nail down doing ecological studies. And then around, I would say, October of 2020, a handful of studies started uploading their results onto preprint servers, which means it doesn't get peer reviewed. You can just kind of post the result of your study for the scientific community to kind of engage in like pre-publication dissemination of new information and look at it. But you got to be careful because, again, it hasn't gone through peer review, and these articles and studies don't always hold up to peer review. But, the FLCCC docs, who, as you mentioned, had been doing really good work at the beginning of the pandemic, with things like corticosteroids, blood thinners, statins, they kind of caught wind of what a lot of doctors had been doing all around the world. And so the idea that they kind of thought of this first is not true. They kind of caught wind of what, different physicians in different parts of the world were already doing. And actually, there's a lot of countries, I don't want to say a lot, but there's definitely a handful, maybe a dozen countries or so, where it's actually in the national treatment guidelines. I should clarify so we don't get dinged by the YouTube overlords that the official position of the World Health Organization is they recommend against the use of it outside of a clinical trial. That is also the position of the CDC, the European Medicines Agency. The National Institutes of Health says they have insufficient evidence to recommend for or against it, and the FDA does not recommend it.
Right. I'm
just
glad
to put that out there.
Thank you for doing that. But I think we're good, actually, because I think so far, I have no question that we're going to be good, because the thing here is that I think it's interesting because obviously ivermectin use, from what we've been talking about so far, has been, mostly pre-2021, pre-vaccines, where we're talking about, if you've got, basically it was doctors dealing with this rush of patients early on, not sure how to deal with COVID-19. Like you said, there were all these sort of different experimental treatments. I mean, experimental, I don't mean anything that's going to like cause harm to somebody, but I mean, seeing what works. I remember early on reading a story about a doctor who found that there was this machine that they usually wouldn't use for patients that were, I don't remember exactly the details, but something like there was a machine where they usually wouldn't use for patients that have those symptoms, but for some reason he tried it with a COVID patient, and it was helping them. I don't recall, but obviously doctors were trying all these different things early on, with the goal being save as many people and try whatever we can until we figure something out to hold off for that vaccine.
Right.
And And it's weird to me how, like you were saying, 2020, you got, all these countries using ivermectin because they're doing what I just said. But now, in the US, we're months into having a vaccine now. And I feel like we're just really getting into the ivermectin discourse. Like I honestly, like, I remember the hydroxychloroquine issue where Trump was promoting that early on, and that was a big thing in America, and you had people going out and taking it without doctor prescription, people taking the wrong thing. I remember there was a couple that like died from taking it,
Fish tank cleaner. Fish
yes.
tank cleaner.
Yes, and it's like, we'll talk more about the issues there with, with people, what people are doing now. But I did not hear ivermectin until, I have to say, this year. Like, I did not hear about it
Hmm.
at all in 2020. Maybe it's my blindness to what was going on in other countries, but I mean, it was not part of the American COVID-19 discourse at the very least.
No, not at all. And I mean, the hydroxychloroquine, that, see, when we talk about trying things out, it's, when you're in the position of having to treat people, you are they talk, the old saying is that you want to avoid the twin traps of overtreatment and therapeutic nihilism, where you don't want to expose people to any chemical or any intervention that might harm them. At the same time, if you sit back waiting for flawless evidence before you do anything, you can actually allow people to come to harm. And it's very much about finding and striking a balance between cautiously trying things based on plausibility or clinical observations, in some cases limited evidence to try to help people, but you have to be very cautious, and you can never talk about things in a manner that is not commensurate with the evidence you have. You can't say something's a miracle cure when you have observational evidence to back you up, right? And that is what becomes a problem. And hydroxychloroquine was presented as some kind of magical cure-all, when in reality there was a plausibility. It had shown potentially some antiviral activities, and it's known to calm, an excessively overacting immune system. But what we found is that it wasn't really doing much, and that really kind of shook the medical community, because doctors were writing for that in the hospital en masse. And it turned out some evidence showed that it might have actually been worsening things, although I think that's been a little overblown too. And there have been a lot of other treatments du jour that turned out not to pan out, like convalescent plasma. The research was back and forth, and ultimately the best evidence we have is that it really doesn't do much, if anything, in COVID-19. Actemra or tocilizumab was another one that, there were studies that showed it worked, it didn't, it worked, it didn't. Overall, it looks like there is some benefit if used in a specific niche setting. There was blood thinners, which now the Hep COVID trial, the best evidence we have now shows if you start full dose blood thinning early on, you can save lives. But intermittent in the middle of that, there have been multiple studies that showed no benefit, possible harm. And there have been a number of things. And so the medical community rightfully becomes very skeptical when anyone comes out and says, aha, we have the big cure that's going to save everyone's life. Because when you make grandiose claims like that, you got to be able to back it up with solid evidence. On the other hand, I think people in pop culture and sort of general discourse about medical culture tend to have the misconception that what doctors do is everything that they do is based on gold standard randomized control evidence. And in reality, particularly in infectious diseases, the majority of professional medical treatment guidelines are actually based on pretty low quality evidence, because sometimes clinical trials that are better designed are not feasible. They may be unethical in certain situations. They're just not tenable. And we're working with expert opinion, or working with like very limited case control or cohort studies. But as better evidence comes along, you have to follow that evidence. And if a medicine becomes an ideology, when another study comes along that's better, that says this isn't working very well, it becomes, well, that's a big pharma planted study. That's a big giant scheme to discredit this drug, as opposed to, okay, I'm going to modify my positions now that better research has come out and showed. And I've been able to do that because I'm not a zealot or an ideologue about medicine, versus a lot of people who have become real sort of ivermectin zealots. Any study that comes out that does not support the hypothesis is somehow like a fake study or some kind of like Bill Gates plant. And, unfortunately, I guess that's just the nature of the beast. What we've seen is that there have been multiple studies that showed benefit of ivermectin over control groups that have been fraudulent. And a number of the studies have not been of the highest quality. There are a handful of them that have been good. And what I see in the data leads me to believe that I think the majority of studies are actually ongoing. There's more studies coming in that are still being conducted than there are out. And I have a hunch that we are going to see some degree of benefit. And what really concerns me is that predominantly on sort of the center left and on the left, everyone is so excited to kind of dunk on this drug and say it's stupid and it's only for horses. And anybody who believes it might offer some benefit is just completely idiotic and what's wrong with you. And if it does show ultimately even a modest benefit, I don't know about you. I'm concerned about a gigantic, like, right-wing anti-vax, like, credibility boost, right? Where it's like, it's.
I know what you're saying. Let's get that in a second, though.
Yeah.
I don't think that, but I know I see the concern. I understand the concern. But before we get to that, I just wanted to say, because it was interesting to me, because what you said is absolutely on point about. It seems like there are people who are, like, hanging their hat on ivermectin. Like, that's become part of their identity. And it's so bizarre to me. Like, I don't know if this is something that usually happens in the medical world. I mean, I know little to nothing about health and medicine. That's why I had to have you, a doctor, on to discuss this. But it seems bizarre because, like, I understand actually, like, and I assumed that, this COVID-19 new disease, new virus that just came in the past year and a half or so. Doctors were, blindsided by it, not sure what to do, not sure what the proper stuff to give or to treat their patients with when this was first going on. So it made total sense that you would be trying different stuff. And I think that's totally fine for someone who is a professional, who knows, the side effects and the proper dosages, to even try with experimental drugs. It makes sense. And obviously, if your family member is dying and from this sort of new disease, the new virus like COVID-19, what's the harm that's already the harm is already happening. So you want a doctor to do whatever they think they can to try out. So I totally get that. But it seems to me that there is this weird thing where it's become part of. I've never seen this for medicine before, where people are arguing over, like, are siding with, like, unproven medicine in either way, like you said. But I do get the left, though, because I'm in that group. You could check out some tweets, but I'm specifically talking about one specific thing, the horse paste thing. Like, I get the dunking on people who are using it, because I'm not, and I think this is probably true of most people, because if you're knocking those people who are ivermectin zealots, you probably are even in your lane where you believe in the science and following where results take us. And to see people go out and buy literal horse version of ivermectin, it's insanity, quite frankly. I mean, it's insane to see that. So I do think that's, when people are talking ivermectin on the left and they're, bringing up the horse paste online, I think they're definitely talking about that very specific group of people. Because listen, if you are someone out there who is sick with COVID and your doctor prescribed you with ivermectin in the human form, then I'm going to assume that your doctor knows your health and what's good for you, and decided that what's the harm in trying this out? Because maybe you have some sort of immunocompromised position where you need it or something, whatever it may be. That you're not the person I'm talking about when I'm knocking the horse paste eaters. I'm literally talking about the people eating the horse paste.
Yeah, no, I mean, understandable. I mean, a lot of people are, somebody actually gets it from a human physician and they'll make jokes. Oh, what kind of livestock animal are you? And I get it. It's comedy. It is funny. Comedy is comedy, and it does make for a funny story. But, I think it's because it was so sort of overzealous and so over promoted. And you have people that had such distrust and fear in the vaccines, in this concept that they're all lying to us and they're trying to keep it, and that they just became desperate and couldn't find human doctors to prescribe them the human form. And they go read things online and they read things people tell them, oh, it's the same thing. You just got to measure it out the right way and do the dosing conversion. And people actually think that's perfectly fine. What people should know is that the difference between livestock medicine and human medicine is not the actual, the active drug, but the percentage of impurities that are allowed by regulators is a lot higher in veterinary grade medicine.
Right.
So if you're ingesting medicine that's meant for horses, you are ingesting a degree of impurities that would never be allowed into human medicine. It's a terrible idea.
Right.
Furthermore, a horse is a pretty damn big animal, and you make one little mistake in your mathematical conversion, you could kill yourself pretty easily. I mean, the lethal dose is actually pretty high, but you can easily end up in a severe intoxicated state. And in a non-medically supervised position, again, overall a very safe drug, but there are specific contraindications if you have any kind of medical history where there's compromise to your blood-brain barrier, for example. This medicine can actually be a powerful neurotoxin and can be very dangerous. It has drug-drug interactions. So if you're on other medicines that might potentiate those medicines or something, or vice versa, like doing things outside of the supervision of a physician in general is not a good idea. In taking any medicine that's not human grade is an awful idea. Yet people became so much in a craze in this concept of they're hiding the truth from us, and it's a big conspiracy, and doctors won't prescribe it because they're afraid and they're all hiding the truth. That conspiratorial thinking, people take things to extremes. And now look, you see, rises in calls to poison control centers. People are literally ingesting animal medicine, when in reality, in other countries, they're prescribing the human version pretty routinely, and they must be looking at us like, what is wrong with you? You've got like people who want to try this medicine are not finding doctors will prescribe it. They're ingesting veterinary versions, yet at the same time, it's being over promoted as some kind of cure-all when that's absurd. Like it may have my best guess is it may have an adjunctive benefit, meaning when it's added on to other therapies, it may reduce disease severity to a certain degree. That's not the same thing as being a cure. And that's not the same thing as like not needing a vaccine. That's absurd. And I don't know if you want to get into what happened with FLCCC and how that whole...
I do, but I just want to ask you another question about this, because God forbid, and I want to make sure, if you are someone watching this, I'm going to assume my audience is not, but if you're someone who just stumbled upon it on YouTube, Twitch, the podcast, and you're listening and you just happen to have your newly bought apple-flavored ivermectin horse tube next to you and you're thinking about taking it after coming across it on Facebook, what could happen to you? Because one thing I will say, like you said with the hydroxychloroquine people who took the wrong thing and people died, I have yet to, and knock on wood, I have yet to hear that anyone died from taking too much of the ivermectin horse dewormer. But I have heard people get very sick. I've heard people have bowel issues. I've seen something, I brought it up last week, and a veterinarian called into the show to tell me that people should absolutely not do this, where people who were taking the paste, the horse paste version, didn't like the taste and were considering taking it anally, like up the butt. I mean, what could happen to you if you take this and and obviously you shouldn't be, but like what could how sick can you get? What could go on here?
People are going to take this rectally, you're saying?
Yeah, that's what I saw in a Facebook group that talked about it. And there are people who are talking about how they were losing their ability to control going to the bathroom, like they were just going.
Yeah.
I don't know if they took it rectally or ingested it normally, those specific people. But from what you understand, just taking the wrong thing, the wrong version of ivermectin, like what could happen to you? I want to make sure people know that like this is not something you should do.
A confusion, disorientation, nausea, vomiting, convulsions, visual disturbances, tremors, severe lightheadedness, severe fatigue and somnolence, so basically like a neurotoxin, severe gastrointestinal symptoms, diarrhea. Those are kind of like the big ones. Liver injury. Those are kind of the biggies.
Now, I want to make sure I'm following here too, because I've seen people, and this is always bizarre to me. I've seen people talk about, they take it once they get COVID. And then I've seen people talk about, and this is usually the horse pace people, because obviously your doctor probably isn't going to prescribe the human version to a completely healthy person who's not got COVID. I've seen people talk about taking it beforehand as like a preventative measure. Is that is that a thing?
Yeah.
It is.
Yeah, so there's pre-exposure prophylaxis and there's post-exposure prophylaxis. And both of these have been studied. So, for example, the All India Institute of Medical Sciences, a doctor over there published a case control study of healthcare workers, again, early on in the pandemic, way before vaccines. And he did a retrospective analysis of those who took it like once a month versus those who didn't take it, and actually saw like a pretty significant reduction in the group that took it. But again, retrospective case control studies, there are a lot of potential confounders there. You don't want to use a study like that to make a conclusion. Then there was another doc in Bangladesh who did a very similar study, once a month dosing. He followed healthcare workers for 4 months. At the very end, like there was something like 70% less in that ivermectin group were actually came down with symptomatic COVID. And then that AIMS doctor then did a prospective cohort study published in Curious, which isn't exactly like a top medical journal, but apparently did something like 3,500 healthcare workers, and about 60% of them took 2 doses of 0.3 milligrams per kilogram, pretty standard dosing. And then about 35% of the healthcare workers took just 1 dose of it. And then about 5% of them took 1 dose of it. And then about 35% of them just opted out and said, I'm not taking it. And there was something like an 82% reduction in the members of the group that took 2 doses who got symptomatic COVID compared to the other one. So, and then there was another study that was also a retrospective study in the Dominican Republic where they did the same thing, and they found similar results. Now, none of these are the gold standard evidence. None of these are randomized, blinded, investigator, subject blinded, placebo controlled. But these have been some of the studies that were observed. Now, there is one study that people were quoting all the time down in Argentina, where they supposedly treated like 1,200 healthcare workers. I don't know if you caught this, but in BuzzFeed, my new friend Gideon Meyerowitz-Katz, health nerd as he goes by on Twitter, and his team, Kyle, and they've been sort of trying to tackle all the fraudulent studies that have been going on. And they just wrote this sort of blockbuster article that indicates that that study was likely that either didn't happen or there's a tremendous amount of sort of research misconduct involved in that study. And then there's another study out of...
Is that related to that big study that was being touted by all the, like we mentioned before, the ivermectin zealots that ended up being retracted because it was based on, the doctor who put it together basically was using other people's, studies to put together this paper. And then he found out that those studies were bogus or something was wrong with them. You probably know better than me. Is that the one you're talking about?
No, so this is another one. So, all right, I'll try to clear this up. There's a study that was published, well, not published. It was put up on a preprint server. It had gotten rejected from I think 7 journals, and it was done out of Egypt, I think Benha University. And the apparent study was that they gave this pretty big dose to different groups of hospitalized patients, and then they did what's called a post-exposure, where they gave household members of people who were infected ivermectin and then compared them to control groups, and they reported this huge reduction in deaths. And that was really driving that meta-analysis, meaning when we looked at all the different studies and looking at an overall mortality benefit, that one study was really heavily driving that result of mortality benefit. And it was basically discovered that that study was basically fabricated. And so they had to redo that meta-analysis, excluding that study. And then that, it became much, there still was a slight favor toward the ivermectin, but the confidence interval widened to what we call including the null, meaning it's possible that the overall observed effect is no benefit. This study is not a randomized trial, so it was not part of that meta-analysis, but it was touted by a lot of people where, in South America, supposedly they took ivermectin drops, the healthcare workers, and then in addition to that, they used this thing called iota carrageenan, which is based on seaweed. It's been shown to have some antiviral properties, and that you put it inside your nose. It's like a paste. And apparently the healthcare workers were doing that 5 times a day, taking ivermectin, and they compared 800 people who were doing that to like 420 something people who didn't. And they reported that out of the 788 people who did that, not a single one got sick with COVID. It was 100% effective. And like half of the people, the healthcare workers who didn't do this protocol, got sick with COVID. And that's the, that Brett Weinstein was saying, well, if this is true, it's 100% perfect cure. Why do we need vaccines, right? Well, it turns out that study is probably bogus. Either, the results were fabricated, data was fabricated. I don't know what happened with it, but if you want to read that study in BuzzFeed, that article that just came out in BuzzFeed hours ago, these investigative journalists just did a phenomenal job of looking into that as well. So
I've not seen that yet. I have to take a look. What is this something that normally happens in the medical world? Because it does seem like there are. Again, I don't know, but maybe this is something that usually happens. But I've never heard of all these. In this specific case, all these ivermectin studies ended up being just like fraudulent or bogus or just not legit. Is this something that usually happens, or is this a case of like you mentioned earlier, people are tying their careers to ivermectin and doing whatever they can to promote it?
Yeah, I mean, there's always been research fraud and research misconduct, but the degree of, then there was that whole Surgisphere thing we didn't even get into, like that, that was all based on like nonsense data collection, but the degree of like wacky research and like sort of discredited shenanigans research that's gone into this one drug baffles me. And I think the problem is like, if this medicine works, that's a big problem, because now you're creating further distrust in it. And if it doesn't work, I honestly think people that can engage in fraudulent research and disseminate findings during a pandemic should be tried criminally, because you are both engaging in behavior that is driving doctors to potentially practice in a way that's not based on good science, and you're potentially eliminating the trust. Like, we as doctors in the international medical community have to be able to have trustworthy peer-to-peer like dissemination of our findings. And if we're not going to trust each other because there's so much fraudulent stuff going on, that hurts the medical profession. It's a gigantic threat to global public health and safety. And that's a big problem. So because these individual studies were either fraudulent or involved a lot of research misconduct, does that mean the drug doesn't work? No. But it's a big problem. And for all those reasons I listed, this is like a clear and present danger to global health.
Right. Now you mentioned Brett Weinstein before, and it seems like there have been a lot of people, and for people who don't know, he's one of the leading members of the intellectual dark web, that group that includes people like Dave Rubin and Joe Rogan, and Joe Rogan's another one of these guys. I don't know if Rubin got on board, but it wouldn't surprise me. These guys are all sort of backing, like you said, they're tying it to their political ideology. Ivermectin is their thing. They're defending it. And a lot of it has to do with obviously we mentioned that we've been mentioning it throughout that we're being careful. Not really though, because I'm not really worried about it actually, obviously. But there was one or two times where he mentioned making sure to be straight due to YouTube's different guidelines and how they deal with COVID-19 misinformation. Specifically, Brett Weinstein's complained that he's had his ivermectin episodes taken down. I know that one individual, Dr. Corey of that group that you were once a part of, the FLCCC, had his congressional hearing taken down from YouTube. But at the same time, if you go to YouTube right now and you type in ivermectin, and I've watched a few, you see hours-long streams from doctors and other professionals talking about ivermectin in the same way that we are. And those are up on the channel and on YouTube, no problem. And I think the difference is that we are discussing it legitimately and discussing it within the confines of what the science says about it, and not, like you've mentioned throughout as well, talking about it as if it's some miracle cure or miracle drug, because it's not. Right. And, the thing I'm getting to here, though, is that there's been, and I think this is probably what's hurting ivermectin in terms of legitimate use cases for it, and that is the grift that surrounded it. There was a report from NBC News, I believe it was early this week or last week, about the website speakwithanmd.com that's tied to a group called America's Frontline Doctors. And for people who don't recall, America's Frontline Doctors were those doctors that Donald Trump would bring out during the pandemic when he was president to basically push hydroxychloroquine and all other sorts of experimental drugs that were being touted by Trump as the miracle cures. One of these physicians, part of that group, Dr. Stella Emanuel, people looked into her and found that she was talking about how like different cancers are due to people having sex with demons. So a very odd group. But the reason NBC News covered this, and I believe Ben Collins, who's been on the show before, was the journalist behind it, the report, is that a lot of people were buying the ivermectin human pills from that website tied to that group, speakwithanmd.com. And it was all about, the money. I mean, it seems like anyone could have gone to that site and got a prescription, if they paid the price, for ivermectin, which seems like a bad idea. And obviously it makes people...
That's not medicine. That's not medicine.
Go ahead. I mean, I'm basically just, you tell me, the idea that you would buy anything like this. I mean, obviously there are drugs that you could get over the counter, Tylenol for a headache, all sorts of different drugs like that. But it seems like the drug that can help you get through COVID-19 is not quite the type of drug that would be sold over the counter. I mean, throughout my life, whenever I got like a cold or something, I would have to go to the pediatrician when I was a kid, and usually I would get the wonderful bubblegum tasting amoxicillin. Seems like a really simple thing. Kids would take it and get better, but you couldn't get it over the counter, a drug even just like that, which seemed pretty low bore to me. I don't know, but ivermectin seems like something that should not be sold in that way.
Well, in a lot of parts of the world, it is over the counter, actually.
Oh, okay.
Yeah, it actually is. Not in the U.S., though. But yeah, I think actually when I was on TMBS, I think in like late October, I went on there to just kind of give my story of what it was like to be a doctor in the pandemic. And I talked about America's Frontline Doctors and actually contrasted it with the frontline COVID-19 critical care lines, because they both had that frontline and I hadn't met any of them yet. This was just like I knew who they were. And they were part of my story because their steroid protocol was part of how like we got things to be, to get a lot better in the hospital and whatnot. And I pointed out that America's Frontline Doctors was basically like an AstroTurf kind of right-wing operative group. And whenever they talked about hydroxychloroquine and ivermectin, and when you look at the way that like the Brett Weinstein and the IDW folks talk about this medicine, call me cynical and call me skeptical, but I just don't think global human health is their project the way that it might be mine or yours. And I think it's more like question the establishment, man. They're lying to us. The Fauci doesn't know, or the government's bad, right? It's all about that, like making you skeptical that there's really any expertise and that you can trust them, and that listen to us and look at this. Here's the real doctors who are telling you the truth, and they're on our show, and those doctors don't want you to know the truth. Like, that's their project, not actually like, boy, it would be great if this medicine worked because, it could improve global human health and potentially reduce harm with this disease. Call me crazy. I just don't have a lot of faith in the idea that they're coming at it with the same, standpoint as other people are. And then same thing, like Fox News, they would have, they had Pierre Corey on and other people, and like I talked to him before he kind of did that tour and went on Weinstein and went on Rogan and was going to go on Maria Bartiromo. And I said, like, and I was an advisor to the group. I wasn't a core member. So I was just kind of always giving my advice. And my advice was always like, this is low certainty evidence, promoted as such. The goal is supposed to be getting NIH and other groups to study this drug, not promoting it as a miracle cure. And if you're going to go on these shows like Fox News or whatever, they're using you to promote their goal, which is Democrats are bad, the authorities and health experts are bad, and they want to make people angry and distrustful. And if you let them co-opt that message, they're going to do just that. And I think that and like the anti-vax community has pounced on this whole thing as a way to kind of promote their objectives, and that's kind of the way I've seen this play out. But I just don't think there was enough done to counteract that and to be kind of savvy about that and to not let that happen. And then, of course, that led into like the just failure to promote vaccines as the number one way that you prevent the transmission and the disease severity of COVID-19. And it's like you got this whole page dedicated to prevention, and you have these different medicines and quercetin and vitamin C and zinc and vitamin D and whatever else. Fine, that's all well and good. But how do you not have vaccines at the very top of that?
Right.
And by not having vaccines at the very top of that, you are, if not explicitly, at least tacitly promoting the idea that, hey, it's okay to do these things instead of getting the vaccine. And that's how people are interpreting it. And that's how they are communicating it in their circles. And it got to the point where, like, no matter what I said, that wasn't making a difference. It was made clear to me that the vaccine stance is going to remain kind of cautious. And yes, they're effective, and talk to your doctor, but it was never going to be like hey, we're an organization that says go get vaccinated. And I said, I just can't be a part of an organization that's not going to be promoting vaccination. Even, it just got to the point where I had no illusions that I might be able to change things or to kind of calm the messaging down or anything like that. And I just kind of had like an oh shit moment, like, oh my God, like I'm part of a group that's basically linked to people thinking that they can either use a human or veterinary product that's unproven instead of getting a vaccine. And like I had like a full blown panic attack, because it's like it was kind of like the frog in the slowly boiling pot. Like these things kind of happen slowly, and it kind of went from like, okay, like we feel like there's a lot of research centers around the world that have done some interesting studies that are promising on this drug, and our goal is to get NIH to do a study, and maybe McMaster University and others to, and then it sort of drifted to no more studies. We already know it works. No more putting people in placebo group. Now it's promotion. Get the word out. Convince everybody. Tout it as a miracle drug. And it's like, well, wait a second. The point was supposed to be to study the drug. Now all of a sudden it's an ideology. Studies are bad. And now it's like, if you don't believe that this medicine should be in every medicine cabinet, standard of care for COVID-19, you're either like in on it, or you're a pharma shill, or you're captured, or like, so it just, things just kept getting more and more conspiratorial. As the disease kept ramping up more and more, and the Delta variant, and more hospitals were filling up, and it was 99% people who were unvaccinated. It's just anything that any group is doing, either explicitly or implicitly, that's leading people not to get the vaccine, is like a gigantic public health threat. And I felt the need to kind of speak up publicly about that.
Now, what do you think the reasoning is for the FLCCC to go so to hunker down and completely attach themselves to ivermectin? Because we were just talking about America's frontline doctors and their site, not their site, but the one they have a connection to, Speak with an MD, and we discussed obviously there's the grift there. There's a money incentive to just getting people this ivermectin over to the basically over the counter, and they're selling it at a high price for people who to buy it. But what, because the FLCC, unlike that other group, it did seem like they were they had an air of a legitimacy around them early on. Like I mentioned at the very top of our discussion, they came up with like what is it, the Mask Plus?
The Math Plus,
Math
MATH Plus.
And what is that, just so people understand? Because that was, I believe that's something that was rolled out, and people use that to basically treat people with COVID in terms of like how to go about when someone comes into the hospital.
Yeah, no, that's a cool story. And yeah, I mean, the core members of this group are like very highly respected in their field, each pioneers of major modalities in critical care medicine. Pierre Corey is sort of a pioneer and textbook author of what we call POCUS, point of care ultrasonography in the ICU. So using ultrasound rapidly at the bedside to quickly diagnose potentially life-threatening conditions. Dr. Verone is part of the pioneering of what we call therapeutic hypothermia. So cooling people down when they've had an out-of-hospital cardiac arrest to help preserve their brains. Umberto Meduri is considered global expert in the use of corticosteroid in lung disease, and so on and so forth. And so at the very beginning of the pandemic, in the hospital, the treatment that was being recommended by all the, what I'll call the global health authorities, whether NIH, CDC, WHO, was just do supportive care. It's a viral illness. Some people get better, some won't. Give them oxygen, give them ventilatory support, and kind of hope for the best. give them Tylenol, cough medicine, vitamins, fluids. But whatever you do not give them corticosteroids. Corticosteroids are basically a medicine that we use to calm down hyperinflammation. So we use it in asthma attacks, multiple sclerosis attacks, things like that. And the idea was, well, in a viral lung illness, you don't want to be using corticosteroids because if you suppress the immune system, the virus might grow faster, make it worse. And what these doctors figured out very early on is that when you're sick in the hospital with COVID-19 and you've got that pneumonia, that lung injury, that low oxygen, it's actually not a viral pneumonia. Your body has dispatched with the virus. That virus is broken into pieces, and those pieces of viral RNA are now what we call reactogenic. Those are triggering a severe immune response. So it's an inflammatory lung injury that 100% needs steroids. And so against almost complete scientific and medical consensus, they created and disseminated a protocol that was centered around the use of methylprednisolone, which is a corticosteroid. And they got creamed at the time. They were getting discredited and maligned and told that they were being reckless, dangerous. And the other thing, the H stands for heparin, which is a blood thinner that we use. We give through a continuous infusion through the IV to treat either heart attacks, blood clots. What doctors knew on the front lines was that patients with COVID-19 were dying because they were clotting severely. And if you wait too long and you wait for them to start clotting and then try to thin the blood, they both bleed and they clot. And so you really have to start it early. And that was seen as crazy. Wait, you're putting people on full blood thinners when they're coming in with COVID infections. Both of those things have since been vindicated and essentially standard of care, widely understood to be life-saving in the hospital. And we really didn't get that data until months and months later. And so this was a group that was very well known for kind of pioneering the best way. Now, they used dexamethasone in that big trial, so most people use dexamethasone, methylprednisolone. They're just two different types of a steroid. But the bottom line is that in the hospital, this is a steroid-responsive lung injury. And Dr. Corey, what a lot of people don't know, is that the first time he went before the Senate to testify was actually on May 7th, 2020, and it was to give a testimony that it's crazy that we're not using corticosteroids in the hospital as standard of care. That actually got taken down from YouTube as well. And then I think it was about like 6 weeks later, that's when the big trial came out, Recovery, where dexamethasone was proven to be life-saving. So when I first heard about ivermectin sometime in like October, somebody sent me a link. My first instinct was to roll my eyes. And then when I saw who was behind it, that made me take a second look, just because I was so familiar with, the work that those doctors had done early in the pandemic. That caused me to look at the data a little bit more and come to the conclusion that this is something that should probably be subjected to more rigorous clinical trials. We should figure out if this works or not. And I mentioned it in that interview I did. And if anybody wants to ever go back and watch that interview, I was very clear. I'm not saying people should start taking this. I'm not saying people should be stockpiling this. I'm not promoting this as a cure. What I'm saying is there's a signal here and that we need better studies. And it was after that the FLCCC contacted me because someone sent them a link to that interview. And I talked to them. And again, at the time, the goal was no one's looking at this drug. The NIH isn't looking at this drug. The CDC isn't looking at this drug. The WHO isn't looking at it really. Let's bring attention to some of this research, which is acknowledged as being pretty low certainty, low quality research. And ultimately, that's been accomplished. The National Institutes of Health is doing the Active 6 trial, where they're looking at repurposed drugs. They're studying ivermectin. The University of Minnesota is doing the COVID out trial, where they're looking at it along with other drugs. The Principal trial in Oxford is doing a huge trial. They're looking at it. And there's a handful of other big phase 3 trials that are looking at it. And to me, good. Mission accomplished. The drug's being investigated. See what the research shows. But unfortunately, there's been this mission creep to, no. It's now somehow unethical to put people in placebo because we know this drug works. And no, it should just be in every medicine cabinet. Everybody should be taking it. And we have a term in science and medicine called equipoise, which means there's at least enough of a non-consensus and sort of an expert opinion where some people think something works, some people think that it doesn't. That's what we call equipoise. And by definition, it's ethical to put people into a placebo group and compare it if you're still in equipoise. Versus once you really know something works, it does become unethical to study it and put somebody else in a placebo group where they could come to harm. That's being completely abused. and there's these suggestions that no, we have such high certainty and we know that this drug works that no more studying it. Just use it, and everybody should be using it. And if you're not using it, and if you're expressing any doubt about the efficacy, you're somehow, captured by big pharma. And I'm accused of that now, or I'm accused of like changing my mind and flip-flopping, when my position has been the exact same the whole time. This is low certainty evidence of a safe drug without many effective alternatives. And that type of evidence is the basis for a lot of practices in infectious disease. So in a risk-benefit analysis, it's reasonable to try things as long as you are clear and upfront with your patient of your uncertainties, risks, benefits, alternatives, and that you don't go over promoting things and speaking about them in a manner that's not commensurate with your scientific certainty. And that's done all the time in medicine. And again, if better studies start coming in showing us that we overestimated the effect, or that maybe people are coming to harm, it's not doing well, we have to be able to modify our positions. We have to be able to put human health above our own egos about being right. And if you can't do that, you're not practicing medicine, you're practicing ideology. And that's horrifically dangerous, because the public is counting on us to be scientific and not to be ideologues and zealots.
Right. That's well said. So what do you think, though, is that, like, why would a group that, like you just said, it was has so many respected members, and why are they so adamant about, and when I say they, it's weird because the only one I ever see on shows or anything is Dr. Corey. Is it just him that's ruining the name? I don't know. Again, is it just him that's bringing this group down this path, and like bringing everyone down with him? Like, what is I mean, obviously they're not innocent if they're going to let this one, if that's true, this one person tarnish the name of everybody else. So, on them too. But what is going on here? Because again, I don't see like with that Trump group, I don't see the monetary grift here. Is it just to make a name for yourself, or for future, maybe, if I don't know, for future earnings? I have no idea. What is going on?
I'll do my best to answer this. And by the way, Pierre and everyone else in that group is they're like all lifelong Democrats. I think there's like some assumption that they're all right wingers. They're really not.
Oh, to be fair though, when it comes to health stuff, the people it's where everyone's been. I mean, usually when you think of anti-vaxxers, obviously there are the people who are religious, and that's usually more on the right. But there was always like the hippies who didn't want their kids to get vaccinated. And so when it came to anti-vaccination and alternative medicines and depending on those instead of, using that as supplementary if you're into that stuff, that's been something everyone's been involved with to their detriment.
It's true. No. So, yeah, I guess the best way, and I got to know Pierre. I consider him a friend, but honestly, I think he has just become, unfortunately, radicalized. And I think to some degree, coming up in the beginning of the pandemic with this treatment protocol, which proved to be effective, getting absolutely maligned and creamed by the medical profession. And then ultimately what ended up happening was, when that trial came out showing that, in fact, dexamethasone steroid was helpful, there was an article in the New York Times where they interviewed a bunch of people, including the editor-in-chief of the New England Journal of Medicine, and they said, oh, he just got lucky. And then to come up with this medicine and to be using it at the bedside and seeing benefit and trying to get the word out, and I think having people not listen to you, and I think more and more and more he's become just like ingrained in the idea that this medicine 100% works, and that there's just kind of forces that are trying to nail it into the ground to pave the way for pharma and vaccines and whatnot. And I mean, we don't have to be naive. I think pharmaceutical companies that are trying to develop new antiviral drugs probably aren't going to be psyched if an old generic medicine works. I mean, that's not conspiratorial. That's just basic capital. But
also isn't the company that makes ivermectin, Merck, I mean, they're not Grandpa Jim and Mima running the ivermectin laboratory in their little farmhouse. It's not like a small business. This is a big company that came out and said, don't take ivermectin.
Ivermectin is generic, and so the amount of the global ivermectin supply that actually comes from Merck is probably 2%. So if you get ivermectin, it is a very small chance that you're actually going to get a Merck Stramectol pill. So they are actually coming out with a drug called molnupiravir, and they've already signed a deal with the government where they're going to get like X number of billion of dollars if that drug actually passes phase 3 and gets an EUA. So that's where their money is. They're not, trust me, they're not hoping that, that any generic medicine that might kind of compete with their new baby is going to end up working. Although, I mean, I guess you could say use both together, but I think in general, they're not particularly psyched about the idea that medicine could work. Now, does that mean there's a big pharma conspiracy trying to? No, of course not. But just in general, companies coming out with de novo antivirals are not going to be psyched about generic things working. But that's not even the point I'm making. The point I'm making is that I think that just the I guess the psychological effects of what he went through, I guess I'm not trying to make excuses for anybody, just has made him double, triple, quadruple down. And unfortunately, the promotion and sort of it became very clear that he was like, I'm not talking about the science anymore. I'm not talking about the data anymore. I am convinced this is not a data argument, and this is just an argument about the forces and the dynamics that are trying to suppress this drug. And this became his opinion. This became his standpoint, and basically started doing these media tours and going on, the Dark Horse and Rogan, and then Marita Bartiromo and Fox News alongside Ron Johnson, and all these different shows in Ireland and other parts of the world, just basically saying, like, if you don't think this drug works, or if you are doubtful about its efficacy, then like that's evidence that somehow, there's a capture, there's some kind of like pharma plot to sink this drug. Now, your question about the rest of the FLCCC, the majority of the docs in the group weren't really very involved with ivermectin, or they were like, agree that like there's a signal and we think it works and there's benefit and that trials are going to show benefit. But the ones I spoke to in the group were also very uncomfortable with its over promotion, and were extremely uncomfortable with even the suggestion or hint that it could be used as a vaccine alternative. And we're actually quite disturbed by that. But unfortunately, the actual group's media activity and what's said on behalf of the group and what the group posts on Twitter and Facebook and Instagram, like the majority of doctors in the group don't really have any influence on that. And so when people say the FLCCC, I think there's a lot of doctors in that group that get kind of like lumped in with it that don't really have much to do with that, the kind of ivermectin promotion. What I said was like, it's not enough to just not be comfortable with it. You have to be vocal and you have to speak up and say something. And that's, the reason I very publicly left the group was because of that. And really, I think if the group had continued with, here's IMS Plus, we understand there's parts of the world that can't get vaccines and we think this helps. And in post-exposure prophylaxis, early treatment, we think these protocols are good. But first and foremost, if you're in an area that has vaccines, if you're in a country where you have, get the vaccine, please, I wouldn't really see much wrong. And if it just emphatically coming out saying no medicine, ivermectin, or anything else is a vaccine replacement, I don't think anybody would really be motivated to go after them, to be honest. I don't think we'd be having this controversy. But I think any force, any influence that someone puts out there that is going to contribute to people making the decision not to get immunized is doing real harm. And I don't think you can cop out of that by saying, well, we're not telling people not to get vaccinated. We're acknowledging that vaccines are part of the strategy and you should talk about it with your own doctor and, blah, blah, blah. Oh, by the way, ivermectin. If your doctor won't give you ivermectin, here's a directory of doctors that will give you ivermectin. Oh, no, but both are good. You can't play that game.
Right.
I'm not going to play that game. And I'm going to call it out. And if people want to be mad at me or suggest that I'm a turncoat or anything like that, again, my interest is human health. And I don't want to be a part of anything, and I don't want to be tacitly involved in anything that is going to impact human health in a negative way.
Have you, it sounds like you have you received blowback? 'Cause I have seen that apparently Dr. Corey has gone after that. No, when I say gone after, I mean tweeted nastily at him. The guy,
Andrew Hill.
Yeah, the doctor, that respected doctor who originally had that study out, though that everyone was citing, and then retracted it once he found out that it wasn't, on the up and up, which is legit. People make as a journalist, this is what happens. Sometimes you have to issue a correction or retract, and that's what makes you legit for coming out and doing that. When you find out that there's incorrect information, but Dr. Corey went after him online and said nasty things about him. And have you received similar sort of blowback?
Mm-hmm. Am I allowed to swear in your show?
You can fucking say whatever.
All right. Yeah, no, I think the actual tweet was your fake ass something or other is bullshit. Fuck you or something like that. It was the tweet. And I was like, well, I mean, Andrew Hill has done more than just about anybody to try to investigate the therapeutic possibilities of ivermectin. If that's the bad guy, I don't know what to tell you. How is he the bad guy? And he hasn't his entire existence during this pandemic has been the global search for cheap, safe, repurposed, scalable medicines to try to put a dent in this pandemic. He's looked at a whole bunch of candidate medicines. The guy's doing phenomenal work, and from all, I don't know him personally, but from everybody I talk to who knows him, a good guy. And his meta-analysis that was put up on OFID, Open Forums in Infectious Disease, showed a mortality benefit. Now, that mortality benefit, when you take that Algazar study and that NIE study, which is another one that was raised as potentially problematic, that statistically significant mortality benefit kind of goes away. However, his study also showed a number of other interesting endpoints like time to viral clearance. In other words, how quickly do you either turn to testing negative or you don't. So there's a bunch of other studies that looked at what we call virological endpoints, and I think those still hold up. Now, the question is, will that be connected to what we call patient-centered outcomes? So, okay, ivermectin has antiviral properties, and it makes people either test negative sooner or maybe makes the virus clear more quickly than it would without it. Is that going to be connected to dying less, going to the hospital less, having a fever for fewer days, being contagious for a fewer number of days? That kind of remains to be seen. The tricky thing about studying COVID-19 is that because most people go on to survive and to recover, to show a mortality benefit, your study has to be pretty big. Otherwise, you don't have enough power to show that benefit. So what they try to do is add up a bunch of individual studies and add up how many people in the ivermectin arm died, in the ivermectin arms either died, went to the hospital versus not. To begin with, you got to be careful with that kind of research because they use different dosing, different timing. When you give the ivermectin in the hospital or like late 7-10 days in, you're really relying more on its anti-inflammatory properties versus if you do a study where you administer it within like the first 72 hours of symptoms, you're using it more as an antiviral. And that makes a big difference in how you study it. And so he and his team did one of the most sophisticated, elegant analyses of this drug and all the existing randomized trials that I've seen. So to go after him like he's a bad guy just blows my mind. Another guy who's doing really important work is Dr. David Bulware. I'm going to give him a shout out too. University of Minnesota, involved in NIH, infectious disease specialist, mycologist. I've had a chance to have a lot of nice chats with him. And he's very much trying to, in the COVID out trial, look at both ivermectin as well as things like metformin, fluvoxamine. And he has been the subject of a lot of mistreatment and accused of like being some kind of, I don't know, Mengele and Nazis and Nuremberg, all kinds of nasty references, because how dare you put somebody in a placebo group with this life-saving cure that works? Like, he's actually, guys like Dr. Bulware and Hill are the guys who are actually trying to do the kind of research that will move experts and that will move panels to make a recommendation. And they're now being demonized as the bad guy. That's just like, that's bonkers. I mean, but at the same time, you got people running around saying, this is horse paste and nothing more. This is a horse dewormer. Why would it work for COVID? That's also stupid. We are actually doing very legitimate clinical trials to try to answer this question. And so it's almost like I feel kind of like ridiculous that I'm dragged into this talking about this medicine so much, because to me, it's just like, it's an old, relatively safe medicine. There's some studies behind it. They're not conclusive. It may turn out to be effective and hold up to the best gold standard trials. It may not. There's like other drugs that we started using too that I think are of benefit that I haven't talked about as much because they haven't been as controversial, like Phenylfibrate, for example, which I think is going to turn out to be a very effective drug in COVID-19. That was also part of our treatment protocol. It's traditionally used to treat high triglycerides, a type of high cholesterol. If people start running around accusing doctors using that of not knowing the difference between a virus and fat, I guess I'll have to talk about that more too.
Does it
Or
come
if
in
you,
does it come in paste form?
yeah, if it does, then we're going to be in a lot of trouble. Or like people promoting it as a miracle cure, then I guess that'll be a problem. But it's just like, yeah,
that is the issue, though. I mean, really, like, again, I probably will not be changing me, mocking the people taking the horse paste, because again, I'm talking about the people taking the horse paste. I mean, the fact that it just happens to be ivermectin is inconsequential, because to me that drug is not the issue. It's the fact that people are
right.
taking horse paste.
I know.
If it was any other drug that came in, and I'll bring it. I actually have been mocking this other thing. It hasn't happened yet, but I assume it will. Last week, that vet who called into the show to talk to me, veterinarian, he told me that there was a study in Brazil and it's starting to gain traction. I just saw this week. So I was like, oh, wow, we had it on our show last week before any English language outlets started talking about it. But I saw this week Reuters or AP brought it up. There's a study in Brazil that some sort of Brazilian snake has, there's some sort of feature in their venom, not the venom itself, but something in the venom that apparently when, inserted into a COVID cell or whatever, you could probably explain it more, being that it looks like from your reaction, you know what I'm talking about, is really effective at fighting COVID-19. Now, obviously, this is something that they are looking into. It seems very, very preliminary. And if there was anything they could do with this, it would involve them extracting that thing and finding, that whatever's in that venom and creating some sort of medicine from just that thing. But I joked that, watch, you're going to see anti-vaxxers find out about this, read this news story, and you're hearing about all these people buying up snakes and forcing venomous snakes to bite them and to cure COVID.
Yeah.
And then we're going to have this whole thing where all these anti-vaxxers are showing up at poison control, dying of venom, from snakes. It's just, do you know what I'm talking about?
Yeah.
This study?
Yeah, no, Bill Gates just wants you to get a vaccine because he doesn't want you to know the truth that a weekly snake bite will prevent you from getting
right. It's it's crazy. And another thing too, the idea, like, listen, I'm as far as I know, I'm a relatively healthy guy in my 30s. But I know people who are immunocompromised. My parents are in their 60s, and I was worried about them throughout the pandemic, obviously. But we never had to do any regimen. We stayed home during the lockdowns. We lived our life under like we usually would do at home, with some differences. Obviously, not going out and getting food as much as we used to, things like that. We wore masks when we went out, once people started going out more. And then when the vaccines came out, my parents got theirs first because they were older. And then when I was eligible and my other family members were eligible, we got the vaccine as well. That is how COVID affected us in terms of, and obviously there's still ongoing stuff. We still wear masks. We still don't go out as much yet, but we're pretty much close to normal. But the people who are the anti-vaxxers, who've been decrying about how there's this great reset and people want there to be this new normal, and these anti-vaxxers are the ones who are steadfast about going back to how life was before the pandemic as if it never happened, they're the ones who are changing their lifestyle with these regimens. They take multiple different medications a day, it seems like. They're taking, you mentioned that some of these legit or positive looking studies saw people taking ivermectin pill once a month or something like that. You got people talking about their regimen is doing this, and that, in addition to a once a day spoonful of the ivermectin horse paste. It's so bizarre. It's listen, just if you get the vaccine, you can have your dream of getting back pretty close to life prior to the pandemic, because that's what is the recommended thing to do to get back there. I mean, it's just so crazy to me.
Yeah, and the anti-vaccine misinformation has really, and the fact that's gone hand in hand with not just this drug, but anything. There's people who think that as long as you take niacin, you can't get COVID. There's people who think as long as you take enough vitamin D, you can't get COVID. There's people who, I mean, there's people who think, oh, they've got their, oh yeah, I just want to go back to normal, but yeah, here's my quercetin, here's my N-acetylcysteine, here's my vitamin D, here's my vitamin C, here's my zinc, here's my L-glutathione, here's my L-arginine, or I could just go get a shot in my arm that has, extremely high efficacy of keeping me out of the hospital, out of the morgue, and killing somebody else with this illness, and mRNA and vector-based vaccines, adenovirus, probably the safest vector delivery of vaccines that we've ever had. Higher efficacy than we really probably could have asked for a vaccine against a coronavirus. And I think a lot of it involves, I think there's several different dynamics here that are important to think about, like things like the VAERS database. Now, the reason the vaccine adverse reporting system exists in the first place is anti-vaxxers and the constant accusations that the government is hiding bad reactions to vaccines. So they create this very publicly open, available system where anybody can go report, either a healthcare professional or a family member or you can report an event, and it's publicly available and you can tally them all up. Now, the problem with that system is obviously these are not causative. They have to be verified and they have to be run through the appropriate statistical tests to show if they represent some kind of rise above the baseline of how many things you would expect. So if you're giving a vaccine or even a saline injection or any intervention to almost 200 million people, you're going to expect to see a certain number of heart attacks. You're going to expect to see a certain number of strokes, blood clots, episodes of tinnitus, and all these other things because they have annual population incidences that you will expect. And you have to see in a controlled setting if you see things rising above expected levels. And when you properly filter and test this data and run it through the appropriate epidemiological techniques, you find out these are actually very, very safe. But people go running around spreading this VAERS database. This is how many deaths to cause. This is how many heart attacks. This is how many strokes, et cetera, and people don't know the difference. The other kind of stupid take on VAERS is that, everything people are reporting in that system is fake, and anybody can go on that site and just make up anything they want. And my response to that is like, technically, yeah, they can and they do from time to time, but it's almost like the myth of like voter fraud. Like that's not what's, you can actually be prosecuted for falsely reporting a vaccine diverse event on the VAERS database. And I think the majority is that no, these are actually reactions that are happening, but they are just things that may be temporally related to getting the vaccine, but not causative. And it takes much more of a sophisticated approach to actually determine causation. When you do the appropriate controlled research, you find that these things are very safe. They're not perfect. There are people out there who have bad vaccine reactions. Anybody telling you that not one single person has had a serious reaction to this vaccine is being absurd. That just does not happen with any intervention. But the rates are so low that I tell people who are hesitant, like, your individual risk of going and getting a vaccine and having some horrific thing happen from it is unbelievably low. In any horror story you're hearing from someone, what you're not hearing is the 100 million other people who got it and are completely fine. And you have to think of in terms of risk and the likelihood that, especially with Delta and how contagious this thing is, dude, you're getting COVID. We're all going to come in contact with this thing and it's going to infect us. And it's a matter of, are you immunized or are you not? And I told you I work with long haulers.
I was about to ask you about that. Yep.
There are people who are young and healthy who don't even get that sick. They never go to the hospital. They got a cold for maybe a week. Maybe they're in bed a couple of days. And a year later, they're still debilitated because they have chest palpitations, shortness of breath, brain fog, confusion, tingling, burning sensations in their arms and legs, can't go up a flight of stairs, can't pick up and play with their kids, can't think well enough to hold down a job. This virus does all kinds of funky, crazy shit to human physiology that we're still figuring out. You don't want to mess around with this thing.
Do we know why? Because you got a cold or flu, and the right loves to compare COVID to the flu. So let's do that here. Let's play that game. When you get a cold or flu, I'm sure people who get very sick and go to the hospital. If you're older, especially, things like that can be serious, obviously. But for the most part, when you beat it, you beat it. What do we know why there are these cases where people are just, it seems like they might be stuck with COVID-19 related symptoms for life?
Mm-hmm. I don't know if for life, but certainly very prolonged. So we call it, the official term is PASC, post-acute sequelae of COVID-19. And it actually brings up very interesting questions about the concept of what we call pathogen persistence. So when you recover from an illness from certain types of bacteria or viruses, do those viruses or pieces of them or those pathogens stick around in parts of your immune system and continue to cause problems? And the sort of academic mainstream, what I call the ivory tower of science and medicine, has been very resistant to that concept. But there's a lot of microbiologists, immunologists who are studying that concept and have been for a long time. In COVID-19, this is what we're seeing. What we're seeing is that pieces of that SARS-CoV-2 spike protein and a particular subunit of that protein, they just stick around in what we call your antigen-presenting cells, your monocytes, your macrophages. And the job of these cells is basically to be almost like tattletales. And they go around, more like they're something between a tattletale and a garbage truck. They go around and kind of looking for things that aren't supposed to be there, and they present them to your immune system for your immune system to then fight and attack. And what it seems like is that these pieces of that dead virus just are persisting in our antigen-presenting cells, and they are just causing this prolonged, unremitting, constant state of inflammation. And because that inflammation is taking place in the lining of blood vessels, it's causing what we refer to as small vessel vasculitis, so inflammation of blood vessels. Everywhere in our body needs a blood supply. And so literally it can affect any symptom, cause just any system, and cause just about any symptom. So neuroinflammation causing things like brain fog and confusion, in the heart causing things like chest pain, in the lungs, shortness of breath, in the nerves and the small fibers that make up our nerves, causing issues with balance and gait and tingling, numbness, loss of sensation. And so we're experimenting with different types and studying different types of medicines, trying to get that process to stop and trying to get those antigen presenting cells to stop signaling for inflammation. Another really important aspect of COVID long haul disease, which may be connected to that persistence of pathogens, is that it really makes our platelets go nuts. Our platelets are a crucial type of blood cell involved in clotting and coagulation, and without platelets, we would bleed. In severe platelet depletion, people can bleed to death. With excessive activation and aggregation of platelets, you can actually lose blood supply because they clog and block arteries. And when they did autopsy studies of patients who had recovered with COVID-19, they found that the sort of parent precursor cell, the platelets, were built up in the capillaries of circulation in the brain and occluding them. And so there's a bunch of clotting factors that are involved in this COVID long haul disease. And then there's basically chronic inflammation from the persistence of the pathogen, where the body just seems to not clear it very well. And so this is very cutting edge stuff. We're still learning more about it. Hopefully we're going to start learning about potential therapies to get people better. But for right now, you're at risk, not necessarily of die. Like if you're a relatively young, healthy person, the likelihood you're going to get COVID and die is pretty low. But it's been estimated that something like 1 in 3 people who get infected with this thing will end up with some kind of post-acute sequelae. And that can last anywhere from a few months to, like, I have patients who got COVID maybe in March of 2020. They're still not right.
Jeez. Wow. I mean, it's amazing that they're, those people, I'm sure quite a few of them, if they had the vaccine available to them, they would have been happy to get it and avoid these long-term issues that they're dealing with. And the fact that there's people who can get the vaccine today who have not yet got COVID and are instead taking all of the different medications being promoted by grifters, it's sad. It's just so sad to see, because every time you see all these deaths that have been coming and out in the past couple of months, and I honestly was, and maybe I would love to hear your take on this. When the vaccine, as a doctor who's been going through this, has been dealing with patients with COVID for so long now, did you think that we would be at the point we are now, where we are, in my estimation, going to end up maybe, if not worse than, which is totally possible, close to the worst of the worst of this past winter in the coming months?
I would not have expected that. No.
It's
I know a lot of epidemiologists did, but I would not. I'll be honest with you. I'm not going to lie and say, yes, I was expecting this. I was not.
It's amazing. Like I didn't think we would get back to how, it would just be like that and everyone would listen, but I had no idea that, I guess the combination of the Delta variant being so strong, I don't know how to explain it, but
It's getting the ability of the virus to stick to you is getting stronger. And ordinarily, a virus will evolve to become less virulent and more contagious. Because if you're a virus, any being, any entity wants to keep living and replicating. So you don't necessarily want to kill your host. You want your host to cough you and breathe you out in the air and spread you. You don't want to. But the problem with this is that it's not really the viral illness that's killing people. It is like the dead viral fragments causing reactogenicity and hyperinflammation. And it seems like that's not lightening up so much. It's becoming more contagious. I think to broaden the discussion, you mentioned variants, and that's very important because we're having this discussion and we're like the media and everyone's like hyper focused on like these anti-vaxxers in high income countries where there's a vaccine and they won't get it and they're the problem. And like really where the variants are coming from is lower and middle income countries that do not have much vaccine uptake, right? Something like the poorest countries in the world that make up 20% of global population have been allocated around 2% of the vaccine supply. And with this disease transmitting, it mutates, and that's going to continue to throw variants at us. And the more variants we get, the less well the vaccines may hold up to protecting against transmission. If we didn't have variants and we had been more aggressive about the just and equitable allocation of vaccines globally, we may have been okay. Like these things were so efficacious that even if we had this little anti-vax community, like we probably could have approached herd immunity. And if we continue to hyper-focus on now booster shots, high-income countries, vaccinate, sell them to all the high-income countries, and we continue to leave all these other parts of the world not well vaccinated, this thing isn't going anywhere. And I think I would like to see more attention from mainstream media on the absolute moral travesty of the hoarding of vaccines of the high-income countries of the world and the poor and unjust and non-equitable allocation of these to the other parts of the country in terms of how unfair and immoral that is, but also in the fact that we're not going to be able to vaccinate our way out of this thing unless we protect all the different parts of the world. And so when I hear all this ire and anger at the anti-vaccine community, and I understand it, you're a healthcare worker, you're getting slammed, it's your third wave, come on, just get vaccinated. Like, we don't need to be going through this right now. I get it. But I think we need to broaden our scope a little bit and see from a bigger perspective what's really going on here and what's going to continue to go on if we don't, as a species, get our act together.
We could go another hour and a half on everything you just mentioned there. So I think that's the perfect place to leave this episode. I really appreciate you taking the time. I mean, I really wanted to have someone on this show to really, this show deals with, a lot of, debunking misinformation and different things like, and different conspiracy theories out there. And so I thought it was extra important, not just to get, the lowdown on these groups that are inappropriately promoting this sort of miracle cure that does not exist. I thought it was also important to get someone who does see some, interesting positive effects from the studies that have been conducted on this medicine, so people could really get the full scope of what's going on here. So, and you provided that perfectly. So, Dr. Eric Osgood, thank you so much for joining me on this show and taking the time. Where can people find you to continue to follow your work?
Yeah, no problem. One last quick thing. Is it okay if I say
go
one
ahead.
last quick thing? I mentioned those virologists who very first studied this virus and ivermectin in the monkey kidney cells. They since have been working on human lung tissue to see if in human tissue, ivermectin might work at more reachable concentrations. They've completed their research. They are preparing it for peer review. And we might get a very different answer now that those researchers have looked at human tissue. They're very hush-hush about it. They do not allow for the pre-peer review dissemination of their research findings. But people should look out for that from a national university because we might learn something very different about the concentrations of this medicine that might be effective in humans based on some of this new research. And so I would be on the lookout for that. That may be interesting. And then on the majority report, I am the show to say, hey, there's going to be an interesting Senate testimony in a few days. A friend of mine is going to talk about this drug, and you read that I am out loud.
Oh yeah, was
on
it
the show?
Oh, okay.
Yeah. Yeah, so I thought you might appreciate that.
Oh,
Yeah, people can find me, Dr. Eric Osgood MD, on Twitter. I talk a lot of shit on Twitter, and I try to make funny jokes and occasionally drop serious medical topics and conversation on there too. And if anybody in the New Jersey area has clinical questions or needs any help medically, Dr. Osogood at gmail.com, DROHSOGOOD, Dr. Osogood at gmail.com. So drop me an email if I can be of help. And really, thanks a lot for having me on, man. It's been great talking to you.
Oh, my pleasure. Have a great night. Enjoy the scenery. I love wherever I love that background. It looks so nice. And
it's my backyard.
And thank you for I'm nice backyard. I have no backyard living in Queens, so I'm certainly looking at that. I'm salivating over all that space you got back there now.
Come hang out anytime, man. Open invitation. Come down.
Oh, I love it.
Jersey.
I love it. Good. Thank you for all the work you've done too with taking care of people with COVID. I'm sure it's been very difficult. Year and a half. So keep safe, keep healthy. Talk to you again soon.
Sounds great, man. Great to meet you.
Have a good night.
Meet you too, man.
All right, ladies and gentlemen. Bloop, bloop. There we go. That was, I felt bad for keeping him so long, but I had a doctor on who was part of that group or was, a consultant to that group, the FLCCC. And I really felt like, wow, if we could get a really nice, well-rounded, factual, legitimate discussion about, why the medical community is actually looking at ivermectin and then what different grifters and zealots have done to basically turn people to horse paste. I'm going to take advantage and keep him for as long as he wants. So we will now go to the second half of the show. You will not notice anything different if you're listening to the live stream or if you're a patron. You go to patreon.com/Matt Binder to support this show. Patreon.com/Matt Binder. I'm going to shout out the people who've become patrons since the last episode of this program last Thursday. Ryan H, Vinny H, Jess from the West, John F, KK, Alicia W, and Gabriel W. Thank you all so much for becoming patrons to this show. I always really appreciate people who financially support this show because obviously that is a big ask to financially support anything, really. So it means a lot to me, really. And it's it's September 2nd now. The first of the month was yesterday. Just got the, when Patreon charges everybody. So as usual, we lose people from declines and stuff like that. So again, if you can't afford to become a patron subscriber, please take care of yourself and your family first. Come join when you can do so. For everyone who's financially able to, what's taking you so long? Let's do it. Sign up. Patreon.com/Matt Binder. And if you can't afford to subscribe, but do want to give a little one-off payment, youtube.com/Matt Binder. Hop into the super chat hop into the chat in the live stream right now and drop a super chat. Ooh, that was a mouthful. I'll read all the super chat comments. Also, if you're listening live, open up your Skype program and type in Doomed Live, and you can call into the show very shortly. I'll be signing into the phone system during the break. Well, we will be taking in just a minute. If you're more of a podcast listener, go to doomedcast.com and you can download the audio version of the show. Usually goes up maybe a day or two after the live stream. But if you like listening, while traveling or on your commute or whatever, doomedcast.com is the place to download. Or find the links to subscribe on Apple Podcasts, Google Play, or whatever. What else? Oh, ratethispodcast.com/doomed. Go there and you can leave an review on all the links there that will bring you to the various podcast directories where you can leave reviews, such as Apple Podcasts. Let me read one of the wonderful reviews that I got just this past week. Again, leaving a review helps people find this program. It helps bring the show's rankings up in these directories. So please do so if you have a minute. Let's read this one. From Bet Docs. Falling down our rabbit hole. I thoroughly enjoy this podcast and many others that Will Summer and Jared Holt appear on as we watch and are somehow constantly amazed at the right wing. Ah, you're a fan of the guests of this show. I'll take it. You could swap me out, I guess, right? But I'll take it. Let me continue. Love the chatter and am sometimes shocked at how I'm still shocked at the rhetoric and the grift. Listen, I actually am quite proud of the guests that I get on this show, so I look at that truly as a compliment because guests make this show possible too. Thank you for the review. Please leave one if you haven't already. What else? I don't know. I don't know anymore. It's September already. Can you believe it? Summer's almost over. Let's go to the second half of the show. Well, I'll take calls. I'll read super chats. Maybe a story or two, depending on how much time we got. To the freebie listeners, this is where I bid you adieu. Patrons and live stream viewers, stick around. Don't go anywhere. If you're not in those two groups, though, I will see you all next time on Doomed. All right, we are back. I just quickly ran over to my fridge and refilled my drink. Let me log into the Skype system for calls. Just give me 1 minute here. I told you guys last week how it's been a very hectic month for me. I'm still dealing with the loss of my hard drive. It's actually really fucking with me. But also other personal issues. And then, like I mentioned when I was on the Majority Report earlier today, the storm that hit New York last night. Man, I had water pouring in. I have, let me just log in here. I have those air conditioners that are in the wall, like the in the wall unit ACs in the living room and in the bedroom in my apartment. And water was pouring in. This has never happened before. Water was pouring in from the crevices in the wall, like where the insert is. I can't quite explain it, but it was pouring in, I could not believe it, like a stream, like a river coming through my living room and through my bedroom. I had to use bath towels to clean it up and then use it to prop up against the ACs to stop it from pouring in. I mean, and still that's not as bad. We already have a issue with the leaky ceiling, but oddly enough, that was fine. thankfully. But I feel like I feel bad even mentioning this because people died from the floods. Like something like 25 people. Earlier today on the Majority Report, the number was at 8 or 9 deaths. We're at 25 now. 25 people died, and the stories are so... First of all, a lot of these deaths are in Queens, where I live. And some of these deaths are just scary, honestly. Scary. People living in basement apartments, the water flooding in, like 6 feet of water, like the flooding came up to their ceiling, and they couldn't get out because of the rush of water holding them in, and they drowned. It's just sad. And we just, like, what do we do? Like, how is this happening? The flash flood warning, apparently, from the National Weather Service was the first of its kind ever in New York City. How are we just, like... But we knew this stuff was coming. The storms were getting bad. Like, you see every time there's even a marginally large storm, the New York City subway systems completely get overrun in flood. The public transportation practically is ruined and shuts down. How are we letting this happen? I mean, I know how. There's no care for infrastructure. There's no... Even when it comes to, like, dealing with issues that get people to work, which you think our capitalist system would want, right? As it relates to climate change. Even that, they're dropping the ball on. Because I guess they don't see the immediate financial incentive, right? Oh, so, these people will trudge through the floods anyway and get to work. So, fuck it. Why are we going to invest and fight climate change? It's not shocking. It's not crazy, but what are we doing? Like, eventually it's not just going to be like, 25 people died and, homes were ruined. Eventually it's going to be literally at the point where our lives are upended, not just for a few days, but like for good. Like things will change for good in certain areas. We're just gonna let that happen, not do anything about it. I mean, there's already little we can do to stop it, but we're not going to do what we can, use the knowledge we've gained over the many generations of learning how to build in certain areas that are susceptible to this, technology that can be used to combat the effects of climate change. I mean, I'm not the expert here, but I know this stuff exists. I mean, why are we investing in fucking space travel if we can't even deal with fight flooding, like flooded water gushing through the streets of Queens and drowning people who live in basement apartments? All right, let me take this call. Hey, what's your name? Where you calling from?
Hey, Matt, it's me, Rem.
Hey, Rem, how you doing?
I'm doing okay. How about yourself?
I'm doing all right.
Good. Great interview, by the way.
Oh, thank you. I appreciate it. What would you like to talk about?
Very informative. I don't know. Now I'm like going blank again, like I always do. Had a job interview. That was cool.
Oh, how'd it go?
It went okay, I suppose.
All right.
It's a pretty chill place. Grocery store.
Well, I hope you get the job if you want it, if you actually do want it.
I definitely do. Thank you, man. Thank you very much.
I don't. Some people, just do the job interviews to keep getting their unemployment. So I get it. If that's what you were just, doing, because who knows?
Oh, I don't get unemployment though.
All right. How you? Anything else you'd like to talk about, Rem?
Yeah. Well, I brought up my friend that like a month ago who got sucked into the conspiracy theories and QAnon and the deep state. And I just kind of stopped talking to them because we argued too much and it was becoming upsetting.
What do they say? Like, what is their like main thing?
That the vaccines, they like, just like what everyone says about the vaccines, that they came in too quick. They were like, it was too fast. And like,
I mean, listen, I get the hesitancy when we were if we were in December or January, and you were playing wait and see. I mean, I don't know what they think at this point. What's going to happen? Like, this stuff doesn't just linger and then affect you and do nothing, and then just all of a sudden affect you like years down the line out of the blue. Like, this is something that literally leaves your system after a certain amount of time. So I mean, like, if it hasn't affected people who've been the millions upon millions who have taken it by now, it's not gonna.
for sure.
I mean, yes, like we mentioned with Dr. Osgood earlier, there have been a very, very, very small number of people who have had adverse reactions to the vaccine. Very small number, as you get with any sort of medicine, even medications that have been been in circulation for decades and decades. But in terms of the vaccine, it's proven to be safe. There's no other way to say it. The proof is the fact that something like 50 some odd % of people in this country have gotten it and have not had anything happen to them other than not get COVID, or got COVID and survived it very easily because they were vaccinated. Yes.
Yeah, I try to tell them everything, but then it was something unrelated to conspiracy theories that made me stop talking to them. That really upset me. So I was done, and it was disappointing, and especially when we started arguing about Biden and Trump, and he was mad at me for like always talking shit about Trump. And I was like, really? I mean, you never seemed to care. You always seemed apolitical, and I just ranted to you because I thought you're my friend, but apparently he was mad that I wasn't going after Biden. Like, what do you mean? I hate him. I don't like Biden. He's not that great. At least he's not Trump, I suppose. But
I mean, I do gotta say, so far I've been impressed with some of the positions Biden has taken. I mean, obviously there are definitely disappointments in terms of different areas we can discuss, but when it comes to for example, most recently Afghanistan, like I'm shocked. He did what he did, and not only did that, held the position. And then some of the speech he gave too was shockingly good.
Oh, I missed it, but I didn't like some things he was saying, or just the way he says it. I guess I don't know. It's just
listen. I'm not saying. Listen, I'm not saying I'm a critic of him as well, but
I know you are. No worries.
I mean, the idea that he came out and said that it's time that the America stops like, I forgot what the exact quote was. Hold on, I retweeted it too because I was so shocked to hear him say it. 1 second, I think it's totally worth
the Forever War or something like that. Did you bring that up?
Let me just hold on. Let me. I want to get it. I want to get it right here because
Go for it.
It was a tweet actually, but it was tweeted from his speech. This decision about Afghanistan is not just about Afghanistan. It's about ending an era of major military operations to remake other countries. Like, what? Like the anti-imperialist left, those people who are claim to be the one true leftists, the only true leftists, like the Dorites. I don't know how they're not like salivating at the mouth over that. I would be shocked to hear that from a president. President Bernie Sanders, to be quite frank.
You got to put yourself in their shoes, like with the combo couch people and Dore. Like, everything that the elites do is phony and performative 100%, even though like most of the time they do mean it. Some of the politicians mean what they do.
I mean, in this case though, you had the elites in this scenario. They were on TV shitting on Biden, saying what A, he did it wrong, B, we should have never left. And he, even after that terrorist attack, which we can obviously criticize the reaction being to drone strike and apparently leaving 10 innocent Afghan civilians dead in the path, unfortunately. That's totally legit criticism. But the fact that terrorist attack, which left 13 American military soldiers dead, the fact that didn't deter him in any way from holding the position he had. I mean, it's again, I don't know if I've ever seen that. It was truly shocking to me.
I just think he's doing it a little bit to get, like, I don't know, to seem all anti-war all of a sudden, or I don't know. I just think we've lost interest. I guess the U.S. military and the U.S. government has lost interest with Afghanistan, so they got the hell out of there. Maybe. I
mean, we should have got out. Again, everyone knows we should have. I mean, we should never went. We should never went.
For sure.
I mean, and for anyone who ever questioned that take, the way we ended up getting Osama bin Laden in 2011 should have, quite frankly, nailed anyone who didn't think we could do that without entering Afghanistan. It should have been a nail in the coffin, because it came out that it was basically all based on intelligence. Being in Afghanistan had nothing to do with it.
I 100% agree.
I mean, he wasn't even in Afghanistan.
It's just all very unfortunate. I got a little disgusted seeing the newspaper, the New York Times newspaper, just kind of plastering those soldiers on there, and even though 190 people died, why can't you put their faces on the newspaper? I guess I understand.
I mean, I don't see a scenario where something wasn't going to go wrong. Oh boy, where are you? I'm hearing a lot of background noise.
Oh, very sorry. I am going to the store really quick. And,
all right. And I'll let you go then. Okay.
Okay.
Have a good night.
You too. Thanks, Matt.
No, but I don't see a scenario where the departure from Afghanistan happened without a hitch. I mean, people keep saying, "Oh, we should have started earlier." Well, the fact of the matter is that this wasn't always the plan. I mean, we can talk about a whole bunch of people call me right now. Hold on 1 second. Hold on, callers. We can talk right now, all day long about. Hold on, everybody. Stop calling in for a second. We can talk all day long about the intelligence that showed that, or the lies straight up from the military leaders that the Taliban wasn't going to immediately take over and the Afghan army was going to just fall to pieces right away. I think it's legit. That's legit to talk about. But the idea that they were supposed to prepare for this to happen in a way where this wasn't always going to happen quickly. Do you know what I mean? The second the rollout to get the soldiers, to get people out of Afghanistan was going to start, the Taliban was going to start making their moves. I mean, it didn't matter when at this point, because we now know that they were already making the moves throughout this whole time period. They were already cutting deals with different leaders in different areas and different villages, making it quite clear that this was going to be the plan. So this would have happened if we started in May, if we started in June, if it was a slower, prolonged rollout. They were going to do this. And then, of course, another thing, and the Taliban affected, I guess, the August 31st deadline, but I think Biden made it clear he wanted that as well. But the Taliban also had nothing to do with that terrorist attack. I mean, I feel like people in this country really don't understand the difference between these groups. I mean, obviously, you don't have to pretend that they also are under the belief that there's good guys and bad guys. That's not how things work. But the Taliban had nothing to do with that terrorist attack. It was an attack from ISIS. I don't know what I should have someone on to talk about the whole ISIS K thing, but I feel like that's sort of a, maybe I'm wrong though. I feel like that's sort of a like a military propaganda thing, but we'll stick to the facts here. It was a terrorist attack from ISIS to basically attack the U.S. and to undermine Taliban, because the Taliban is going to be at war with ISIS now for control, basically, of that country. All right, let's go back to the calls. But, at the end of the day, I think on a number of issues, Biden has sucked, obviously. But then surprisingly, on another number of issues, he's been pretty good. I mean, obviously, he needs to expand the courts. He needs to advocate for the removal of the filibuster. He needs to get strong on applying pressure to some of these conservative Dems like Manchin and Sinema. He needs to fight for voting rights. He needs to keep his promise when it comes to student loan debt. But I am true, but those are things we knew. Those are the fights we knew we were going to have, right? I mean, I am truly shocked about his, not just his actions, but his rhetoric surrounding the withdrawal from Afghanistan. All right, let me go back to the phones now. I'll also read some super chats, so feel free to... Oh, let me take this call right now. Hey, what's your name? Where are you calling from? You're on the air.
My name is Brian. I'm calling from Boise, Idaho.
Hey, Brian from Boise. What would you like to talk about today?
Well, I messaged into the Majority Report today, kind of talking about how my wife, who had been hesitant about getting the vaccine, sent me a message at work and said that she was going to get it. And so, yeah, it's just kind of a good day in that sense.
I'm so happy to hear from you. So you just gave the rundown, but for people who aren't familiar, I am on the Majority Report for the second half of the show, along with Emma Vigland and Brandon of the Discourse. And you had IM'd the show, basically with what you just said. And I was very interested to hear, because you just basically IM'd and said, oh, my wife was hesitant to get the vaccine. She read a lot of misinformation and was swayed by it. What really concerned me was you said you guys got kids. And as a father, that connects with me as well. And you said she had some medical issues, which obviously made her more susceptible to COVID symptoms being truly worse. And so I was very interested in hearing what you did to convince her to send you that message today saying she was going to get the vaccine. Well, first, let's get this straight. Did she end up going to get the vaccine today?
So not today. She stays at home with my daughter pretty much all day long. So we're kind of waiting until, because I work Monday through Friday, I do hardwood floors. And so anyways, we're kind of just waiting until I can have the time so that way she can go get it done. So it's either today or tomorrow or Saturday. So yeah, so we've been talking. I mean, I got home at like 7:00 here in Boise, which is not too long ago. So we haven't really had a whole lot of time to kind of discuss the full details, but yeah, it's
so she's still saying she's gonna get it.
Yep, yeah. So I mean,
so what did you okay, go ahead, start. What did you do to convince her?
Well, so I was gonna say, she's not like, I should start by saying she's not like kind of the crazy anti-vax type people. So like I didn't have to deal with some of the other things I hear living in Idaho. So that was nice, but it really, I think, came down to just like, she used to be pretty prone to having seizures, and since having her daughter, her heart palpitations become kind of more regular, and just, there's a ton of kind of crazy misinformation out there, and I don't really talk about politics and a bunch of stuff with her. It's kind of like, my interests and stuff. And yeah, so I don't know, it's just gradual. We would have conversations about COVID. I've been vaccinated pretty much since the vaccines got rolled out because, like I said, I do hardwood floor, so I'm in and out of people's houses all the time, and it's scary because I'm single income, and I got 3 kids and mouths to feed, so it's just kind of.
I'm in the same position as you, man. But I got 2 kids, but same thing. My partner, she stays home with the kids because obviously we did the cost benefit analysis that
Yep.
it makes no sense to hire somebody if basically one full income is going to be paying for them to watch the kids when when one of the parents could actually take advantage and stay home with the kids. But also I'm in a lucky scenario where obviously you can't do this as a hardwood floor person, but I'm able to remote work. So since COVID, I've been able to stay home too.
And we, and living in Idaho, we shut down for the first 21 days in April last year, and then it's been basically fully open since then. So it's just kind of I sometimes feel like I'm surrounded by conservative echo chambers on a daily basis. So it's just, I hear the misinformation all the time, and kind of the thing that I've noticed the most is that it's, like I said, my wife, she's not super into politics. She doesn't know anything. I mean, she just learned who Ben Shapiro was the other day. So she doesn't know the Jimmy Dores and all those, crazy people. It's just, I think for a lot of people, this info comes in via social media or through the pipeline from, people that she knows that are into conspiracy theories and crazy things. And so I think it kind of just accumulates, and it becomes a battle for, people like us and probably your audience that pay attention to this stuff all the time. And you're kind of on an uphill battle. And so it was, for my wife's reasons, it wasn't so, she was she hears these stories about these offhanded side effects, and I'm kind of at this point of with all of the fake vaccine cards and stuff, I never know what to believe at this point when it comes to people having side effects to the shot, because I don't know, I got both of mine, it was nothing, I didn't have any kind of pains or anything, and that's how it's been for most people. My dad's a heart patient, he has a quarter of a heart functioning, he got both of his shots, nothing. So I get, it becomes kind of this because if there are side effects, they're so rare that most people don't have real, I don't know, they don't know anybody who's actually had them. So, so it's just, it becomes kind of this, you hear one thing and then you're trying to battle another thing. And, she, especially a few weeks, I think it was last week or the week before, we got an email from my son's school, and there was 2 cases of COVID at my son's school. And it's just, I think for her, the anxiety about getting COVID finally kind of outweighed the anxiety about whatever random side effects could possibly, take place. And then, I sent my cousin works in ICU here in Boise, and she made a post on Facebook that my mom sent me because I don't even have social media. I have Instagram, and that's it. So I didn't know this, and my cousin has basically been, they're turning storage facilities into spare rooms for people to have beds, and it's just kind of, it's crazy. So I think
where is your, I just want to make sure, because I don't think we sort of nailed this down. I don't want to get ahead. Where did your wife get this misinformation about COVID vaccines? Because you mentioned how she's not in the political sphere, media sphere, where she's familiar with these names. So where is she was it Facebook or something, like her friends on Facebook?
I'm sure it's a combination of stuff that you see on social media, but I know some of it comes from family members without getting too specific. So it's kind of 2 people that you love telling you 2 separate things, and it gets wishy-washy, and there's a lot of people that are just into the conspiracy theories. I mean, I've always had the viewpoint of it's fun because when I was 19, I was super into all the conspiracy stuff because I didn't know anything about governments or economics in any kind of capacity. And so, they're fun ways to paint this picture of a world that you don't understand. And I think it's really attractive for a lot of people. And so I think it just kind of seeps into the ether. And so then you get people like my wife who really doesn't pay attention to any of that stuff. And you get these multiple sides of a story and you don't know who to believe or who to trust. And not that she didn't believe or trust anything I would tell her, but it's kind of the same way if it's coming from close family relatives that, that you also love and trust. So it's just, it's kind of one of those things. I've been super sympathetic to a lot of people who are vaccine hesitant when I hear about it in my job, because I talk to people all over my town and I just try to give them as much information as I can on my end and, talk about how I've been vaccinated and all that kind of stuff. And, it's a big problem that I just don't know what the real solution is. I think other Matt at the end of the majority report today kind of put it best, where you're just kind of ready with the information, and whenever they have questions, the people that you care about or people that you're trying to convince to get vaccinated, you just be ready with the info, because that's pretty much what I did. It was just one, get vaccinated yourself if you haven't been, and then two, you're just there to, I don't know, not force you don't want to force anybody, because that doesn't ever work. So you just kind of have to be ready to give them the info. And, she's been listening to the show with me all night tonight while we were eating dinner, and she's really enjoyed it. So it's just, it's one of those things. I kind of feel bad that I never showed her kind of the
oh, you did this show.
Yeah, yeah, exactly.
Well, tell her hi. I appreciate it.
Yeah, she's in the living room listening right now, so I'm sure she heard you.
Oh, does she want to get on?
I mean, that's up to her. She's probably watching my daughter right now, so she's
okay.
I trapped myself in our bedroom, so I wouldn't have too much background noise or anything like that.
All right, well, tell her I appreciate her listening, and I'm very happy she's going to get vaccinated. I've been vaccinated, and look at me, I'm fine.
She's in the door and she's saying hi. Turn your phone down, honey, because it's probably getting feedback. There you go. All right, she came in.
Hello?
Hello.
Hi, how are you?
I'm great. How are you doing?
I'm doing good. Thank you for coming on to the phone line. We're talking about you, and your husband said you were listening to the show earlier, so I thought, why not listen to you talk to me yourself? Why is he on the phone? That seems pointless at this point. So
yeah, he's got a lot to say all the time.
So I'm happy that you decided to go get vaccinated. That's great.
Yeah, I mean, I want to do it on Sunday. We have plans Friday and Saturday, but Sunday, that's my plan.
Now, when I got it, the first dose, I'm not sure which one you're going to get, but I got the Moderna one. And the first dose, after a few hours, your arm's going to feel a little bit like, you feel a little bit weird in your arm. Like it seems a little like I've got that for other vaccines and other shots, like the flu shot that I've normally taken. And then when you get the second dose, you might feel a little bit out of it for like the rest of the day after you get it. Maybe a little bit tired or, but that's totally normal. And then you could never have to worry about dying of COVID, pretty much.
I love that, honestly, because I've had anxiety about both things, basically not getting it and then getting it, and now I'm just like I just need to do it because I feel like I'll just feel so much better about it. I've got so many people that love me and that want me to do this, and yeah.
Listen, this too, and that's a great outlook, because I think that's obviously what should be guiding a lot of people too, especially, you know, I also have 2 young children, and I know your husband said you have 3 kids, and you see all these stories in the news lately about, like, especially this one guy in Texas. He was a steadfast anti-vaxxer. He was one of those anti-lockdown guys who held rallies to open back up and no more masks. And he's the father of, I believe, 4 kids with a pregnant wife. That means another one on the way. And his wife got vaccinated. He didn't, because he didn't believe in it. And he died. He got COVID and he died. And I mean, the fact that he lived with his wife and she either didn't get it or did not have to go to that, or got sick to the point where but she didn't have to go to the hospital. I mean, it's clear as day to me that, like, I totally get the hesitancy early on when it was first coming out, but we're now at the point where millions and millions and millions of people have gotten it. And, you know, the amount of people who've had adverse reactions are very, very, very small. Totally makes sense to get it compared to the numbers of people who are sadly dying from being unvaccinated.
Yeah, absolutely.
So I'm really glad to hear that from you, especially. That I'm glad you came on the phone. Thank you, and I'm glad that you're gonna go get it. And thanks for listening to the show. I appreciate it. Hope you'll listen to more.
Yeah, I definitely will, and thank you for giving me that much more confidence in this decision that I'm making, because it means a lot.
Oh, great! I'm glad. I'm glad I can help. Have a great night.
Thank you. You as well. Yeah, I definitely will.
1 second. It's on. Okay, there we go. All right, ladies and gentlemen. There was a delay in hanging up the Skype call for some reason on Skype's end. That was a great call. I'm so happy to have, I think she was being nice, but I'm so happy to believe that I played a role in that. All right. There was a bunch of callers on the line. Feel free to call. I wish there was a system I had where, like the majority port has, where you could all line up without having to hang up and having to call in each time. But I don't have that system. But also, I think the calls with my system sound much better. So we give up ease of calls for quality. I'm fine with that. Another caller. What's your name? Where are you calling from?
Hi, is this me? Can you hear me?
This is you. I can hear you. What's your name? Where are you calling from?
My name's LA. I'm calling from New York. I'm very guilty of the very, 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 very long time, but first time. I've been listening.
Oh, that's great, though.
Many, many years of MR to TMBS to this. And I was inspired to call in tonight from the interview you did. Something I wanted to tell you for a while is that I think you do a good job in the progressive independent media space of picking up stories that are there, but people aren't covering. Like, people are just talking about the headline around ivermectin, for example. There's very few people that actually dive in and say, why are some people saying this? Why is there the contingent of doctors that are saying this? And I think that is something that's very needed, because there are a lot of, I don't know what term to give them, but there are a lot of people that live in those margins of, there's a bit of truth to a story, and they use that and they exploit that to attack a group. Say, oh, this group is only saying, they're saying that it's horse paste. They're saying it's horse paste, but really there's this one kernel of truth. And if no one acknowledges that, then it allows people to kind of just have that be their entire grift, really. And by you going into a full-length interview, breaking it down with a doctor who's actually assessed it, who's actually looked into the science of it, it doesn't allow just the knee-jerk, like, headline reaction of, oh, progressives are just saying it's bad because of X. I don't know if that made sense. I kind of rambled through
No,
it.
it totally does, and I really appreciate the kind words. That means a lot to me. To me, I look at it this way: like, what good is it? If you're gonna debunk stuff, debunk lies and conspiracy theories and fake news and misinformation, I mean, it doesn't help to just go out there and not explain where it comes from. Like, there are a lot of people who like to just basically debunk by just saying this is not true and that's it. But they don't, or maybe even they'll explain why it's not true. I mean, that's all good and fine, but why did we get there? And that's why I feel like that's usually not covered a lot of times. Like, why do people believe this? Like, where is it coming from? It's just not enough to just say, like, and you see, like, Politico or other, like, fact-checking groups just basically say, this is not true. What actually happened is this. Okay, that's great, but why did the fake news, the conspiracy theory, the misinformation, why did it come about? Like, where did it come from? How did we get there? And for this, I mean, listen, if you're someone who goes to a doctor and a doctor looks at you, does a checkup, knows your medical history, and says, I want you to take ivermectin. Who am I to say anything to that? I'm not a medical doctor. I'm not a medical professional. If you would like to go to another doctor for a second opinion and they say, do not take ivermectin, then there would be an issue there. Then you would have to really assess the situation because you have two people who are saying two different things, who are professionals and experts in this scenario, in this situation. But, other than that, I can't imagine, like, saying, like, don't listen to your doctor who tells you to take an ivermectin human pill. However, on the other side of the situation, if you were going out and taking the ivermectin horse paste, I mean, you should be ridiculed. I mean, it's not good for you. Don't do it. And so, to just talk about the horse paste without explaining that there is an actual human form of ivermectin, and some doctors do see some benefits, and that's where the ivermectin craze came from. And then that's what led to the horse paste, because people couldn't get the ivermectin in the human form, whether it be they couldn't get the prescription or whatever, which means they shouldn't be taking it then, even the human form, in my estimation. I mean, if you don't break all that down, then, I mean, you're not doing a service to people who might be wondering, like, why? Like, why? It doesn't make any sense to just talk about, like, without that background. But I'm very grateful that you see that in the show. So it means a lot. It means I'm getting through. Oh, did I lose you? Oh, you cut out for a second.
How about now?
I hear you now. Yep.
All right. Yeah, so I was there the whole time listening. So yeah, I mean, I think through doing the nuance, it does allow you to, I mean, I'm not going to be opposed to doing the dunks on the horse pace, because that is something dunkable. And you gain credibility through actually going through the other side of it and saying, yes, this is used in other countries in pill form and human form. And that's not what this horse pace is. And I know that because I looked into it and I did the actual conversation with a doctor. Without going into too many details, I know someone who I will be telling to watch the show that's been looking into ivermectin for months. And I've been on my own trying to basically do research on ivermectin to have a conversation with them about why maybe the vaccine is a better plan than ivermectin. And through that research, it's reading the papers that come out, following the doctors on Twitter and such. And then obviously a lot of YouTube. I'm watching you on YouTube right now. And YouTube is just dominated by either like some doctors doing like some analysis of it. There's some of that. There's the like far end of the right, like fully pushing it. And then there's like superficial, just like a quick dunk, which some of my favorite progressive commentators are doing just that, just the 5-minute dunk take. And I think that's, like I said in the beginning, I think that's why I appreciate this interview so much, because it hits the gap of what is needed. It's like someone that has seen it from the progressive side, understands the ridiculousness as it exists as a political statement of some people, but also can bring in the science behind it and say, there are scientists that looked at this and are now debunking it. And this is a perfect piece of information I can share with someone who isn't in it because they're a right winger, but they are seeing pieces of nuance, but maybe not the whole story.
I really appreciate it. I mean, listen, this to me really gets to me. The idea that ivermectin is like some sort of taboo topic to talk about on YouTube because they'll ban you. I mean, you guys are still watching this live stream right now, right? Now, it would not surprise me if when this show ends and the replay goes up, if this episode got temporarily flagged by YouTube due to the fact that there's ivermectin discussion and there's ivermectin in the headline. I have an ivermectin video up from last week from that veterinarian caller that did not happen. So it's possible it won't happen here either, but it wouldn't surprise me if it did either. But I also know, being that this live stream's gone on without a hitch, and that we've been very responsible when discussing this stuff, that if that happened, I would just file a dispute and they would look at it, a human would look at it and say, oh, this is a false positive, putting it back up. It's happened to this channel multiple times. It sucks. They should get better algorithms looking at this. They should work on the algorithm and get better at it. But I don't go around saying, I've been censored by YouTube when that happens, because these are, if you actually are not running afoul of the policy, they will rectify the situation. It's happened to me numerous times on various different issues. I had a whole live stream taken down because Trump, I watched the Trump speech and he was spreading the big lie about the election being stolen from him. It was taken down temporarily. I filed a dispute. They had a human look at it, realized that I was watching his speech and providing information, context, fixing inaccuracies in his speech. They put it back up. No problem. So that's why I'm not out there doing that. Or B, you actually are spreading misinformation, running afoul of YouTube's policies, and you're whining about it when, listen, we want to talk about aliens and Bigfoot and conspiracies like that. If they started taking down that shit, that's ridiculous. There's no harm there in believing in Bigfoot. You want to spread bullshit about that tells people to go take a horse paste that could be detrimental to their health by telling them it actually is some sort of COVID-19 miracle cure. You're putting people's lives at risk. I think that's well within a company's right to say, we don't want that shit on our platform. I'm sorry.
Sure. If I bring up one more topic?
Go ahead.
So I'm also in New York. So I saw that crazy storm yesterday. That was like nothing in my life. I'm a little bit younger than you. And it brought up the topic, the tragedy. And I'll just say this, like, it's very apparent that when you talk about stories that you genuinely care about them. And I could hear that when you were talking about the tragedy out in Queens. And I have family out in Queens, and Queens is a place where people have basements. And something that just kind of kicked in my brain, surveying the damage today, is like that may become a thing of the past. Just basements there's some places in New York, for people who aren't from New York, that are rented out as basement units. The entire apartment is just a basement.
Right.
And in a situation like this, as Matt described, it's just like impossible to survive in your apartment.
Right.
And funnily enough, our incumbent mayor essentially claimed that he's living in an apartment basement. So it'd be interesting if a journalist dug up, like, if his apartment basement flooded out in Brooklyn.
Are you talking about Eric Adams?
Yeah. So it's just
he lives in a basement.
In the like scandal in the summertime, when he came out, it was like, where does he live? He showed up to his townhouse, but he had rented out the top of it.
Oh, right.
So like he gave a tour, and it was literally the basement of the townhouse.
Right. I didn't even think of that. That's a good point. I wonder. I mean, listen, I know there are people who legitimately convert their basements and follow the legal processes and the regulations and actually convert it into a real legitimate apartment. But we're talking about New York City, especially in the outer boroughs here. I will guarantee you that I don't want to say the majority because I don't know, but it would not surprise me if there was a majority. But let me be more accurate and say A vast number of the basement apartments rented in the outer boroughs of New York City are illegal, and are not converted into legitimate apartments. Do not have the safety precautions necessary. And I mean, I don't know if the people who drowned in their basement apartments, and it seems like to be quite a few. We're talking. I know there was a mother and her 20-some-odd-year-old son in Jamaica whose wall caved in, and the flooding came in from the wall, and that's how they died. And then there was a couple and their 2-year-old child in Woodside who basically drowned in a basement. There was a elderly man who got caught trying to get out of his basement apartment, and the floodwater trapped him, like shot him and held him against the wall, and he drowned. Like, it went up to the ceiling, and they couldn't, and his neighbors tried to save him and they couldn't. I mean, I would not surprise me if it ends up that those were illegal dwellings. Right. I mean, it's possible they weren't. I'm not going to say, but it would not surprise me if it comes out that they weren't. I mean, there should be a crackdown on that. The idea that those basement apartments usually are not. When I was looking for apartments back when we were first moving out, me and my partner, I mean, we visited some basement apartments, and like the idea that you would live in a basement apartment was so unappealing because like it's like you're living in like a dungeon, honestly. Like you get no sunlight. I mean, especially if you're at home a lot, like you can't live like that. Like it's unhealthy. It's got to be unhealthy too. Like, like, you know, it's not healthy to not get like natural sun when it's like daytime out and like just like sun coming in through your windows, even if you're home all the time. You know what I mean? Like it's just like not a healthy, even from like a mental space, it can't be a healthy way to live. So, I mean, I hope they look at the legalities of some of these apartments and maybe even do away with, you know, if affordable housing needs to be made to fix this issue. I mean, it's that simple. People should not be forced to live in basements.
I should have looked this up before I called because I'm fairly certain of it, but not 100%. But I think new units in New York, they're not allowed to have the ground floor have people live on it. So not even the ground floor. So if you look at all the new buildings that go up, the ground floor is always like commercial or it's just the lobby. And I would think that that is in part like accounting for rising waters. And I'm in a building that is pretty new. Our ground floor is not residential, but we had a basement for like other stuff, and that completely flooded in the brand new building.
Wow. I mean, like I said earlier, like I'm on the 6th floor, and I had water coming in through my walls. I've never seen that before, and we've had issues here in this same apartment when it snowed a lot and the snow accumulated on the roof, and it would leak through our ceiling. Like, so it's not like we have some fancy apartment that has no issues. Like, but the fact that just if rain accumulated on the roof, knowing we had an issue, that would have made sense to me. But the fact that this was so strong that it was just like accumulating through the walls, I mean, I've never seen that before. And I don't think this is not an anomaly. This is not something like, oh, it was just the one crazy storm and they're not usually going to happen this way. I mean, sure, I mean, they won't usually happen this way, but these type of storms are going to happen a lot more often until they do eventually usually happen this way. I mean, it's going to get worse. It's not going to get better.
Yeah, I guess I'll leave on this point just to echo that. There was a great tweet. I think it was like National Weather Service that broke down that Central Park had a record-breaking flooding in 1 hour of 3 inches of rainfall in 1 hour, and that broke the record from 11 days ago.
Right.
This is just increasing.
The National Weather Service said they gave the first ever flash flood warning in New York City yesterday.
Flash flood emergency.
Right, emergency. Right. You know what? I forgot to mention. You know what was really surprising about this was just how out of nowhere it seemed to have come. Yeah. Like we've had big storms before. I remember Hurricane Sandy. It was like I feel like it was weeks where we discussed it and how it was going to hit New York and we need to prepare. And even then with that preparation, we were still hit hard and we're underprepared. But this was honestly, I haven't really been, usually I'm very online this past month for various reasons. And I did take a week off. I've been a little bit out of my usual super plugged in to the news mode, but like this really came out of nowhere. Now I know when I mentioned that in the majority report earlier today, they did say, well, there was a little bit of a weather warning, but the assessment does seem to be that they had no clue it was going to be this bad. And it did seem to come out of the blue in terms of the velocity and the veracity of it. Like,
it's hard to come to any other conclusion with the mindset of like, if our governing body knew that it was going to be this bad, then they would have given more warnings before midnight saying, hey, don't be outside anymore.
Right. I'm someone who listens to that shit because I don't feel like rolling the dice. And I got I got a family, so I'm not like I'm going out to like party with the boys or something. I got my kids at home. I'm not going to the office right now. So I mean, I listen to that stuff if there's no reason to go out. But yesterday, I visited a family member. I drove out. It was raining a little bit when I left, and when I came home, like I left at like 6 something, around 6:30, and I got home around like 8:30, 9 o'clock, and it was raining a bit harder, but it wasn't super hard yet. But I wouldn't have even gone out at all, regardless of how, like, if I had known it was going to get to how it got, because I don't roll the dice when it comes to that shit. It's just not worth it. So, like, the idea that I went out and then I dealt with the whole being home and having to deal with the flooding in my apartment, I was totally like, I can't believe this happened because I was totally not expecting it. It totally blindsided me. And it seemed like it blindsided a lot of people.
I totally agree.
Thanks for the call. I really appreciate it. Have a great night.
Yeah, you too. Thanks for having me on.
Do call in again in the future. I know you said this is a long-time listener, first-time caller. May there be many more calls. Have a great night.
All right, looking forward to it.
Peace. All right. Oh boy, going. I'm taking long calls today. I don't think I'm going to get to any the stories because there's a lot of callers. I don't think I'm going to get to everybody, honestly. There's so many that I don't think I can even get to it. But maybe I'll take one or two more. I don't know what's happening. I went to hit call and they, answer the call and they'd hung up on them. All right, here we go. What's your name? Where are you calling from?
Maybe I'll take one. I'm the anti-corporist. I'm from currently the Midwest.
Hey, one request really quick. I need you to turn down the YouTube live stream because I'm hearing that and it's behind.
Okay.
So
yeah, it's behind. Okay, no problem. I'll pause that.
Okay, perfect.
So
what would you like to talk about?
Yeah, man. Oh God, everything. You've been hitting on everything. Just one of the things that I wanted to say. I'm a little bit older than most of the people in here. And I actually started having anxiety in about the mid 80s when I realized what was going on with global warming. I took some class at school that I really shouldn't have taken, but I don't want to be too much of a doomer, although that is kind of good for the name of the show.
Right.
But we've really hit a point here because I'm sure everybody knows this, but the thing that had been keeping it from going crazy with the global warming is the sea had been absorbing the CO2 and the heat, which we hadn't seen. That hadn't been predicted for in the climate models, where they were saying that that it was going to get worse sooner than this. You know what I mean? So yeah, that, and then you got the polar ice melting. You got the ice melting in Siberia with all the rotten vegetation and rotten mooses and stuff under it. That's releasing all of this what do they call that gas? Methane up into the atmosphere. It's bad, man. It's bad. I mean, honestly, we need to do everything we can do, but at this point, we need some kind of crazy tech fix. You know, somebody needs to
don't put your I gotta say, don't put your faith in the tech world.
I'm not, but I mean, I just, you know, there's got to be a paradigm change, because now that we're at this spot, I mean, I don't know. I don't know what we're gonna do. It's gonna come to a point where we're gonna have to do everything we can. You know what I mean? It's not gonna be A, B, or C. It's gonna be A, B, C, D, E, F, G, H, I, J, K, L, M, N, O.
Right. It's
yeah.
I don't know what the answer is gonna be. Honestly, I think this will be the new normal. I don't think we're gonna be able to stop this. I don't know. I don't know what the answer is going to be. Honestly, I don't know. I really, hopefully we start taking it serious. And when I say we, it's really nothing you or I or anyone listening to this show could do. Like, I mean, other than pressure our elected officials to do something. And obviously, it's going to fall on some of the worst of the worst, some of these major corporations who are really the main drivers of what's going on with our climate, to change their ways. And I don't know. I don't know whether they maybe one day we'll get to a point where we decide to do something. Hopefully hopefully it won't be too late to. I mean, it's already too late. But hopefully it won't be too late to basically stop any more people from dying and people losing their homes. I mean, it's stark, man. It's stark. But
yeah, I see people in chat seeing that, you know, everybody needs to consume less, but we're past that point. You know, everybody consuming less isn't going to do it anymore.
Yeah, I see someone joking about I got to stop podcasting and cut back on electricity, but they're joking, obviously. But yeah, there's nothing you and I could do. Like, you can stop. Like, there's nothing. Yeah. It's you are not contributing. Like, we're at the point where, like, even if a vast majority of people in this country changed something, it wouldn't be enough. Like. Yeah, it just wouldn't. They're not causing they're not causing they're not the worst offenders. It's just not causing what's causing it. I'm not saying you know, just throw your hands up in the air and decide that I can't do anything, so I'll just waste. But I'm just saying, like,
it has to be a political solution.
Right.
You know, so on the days when it's not too hot to go out and we're out in the middle of a pandemic, we should go protest somewhere.
Mm-hmm. Right.
You know, I actually at the beginning of the summer, I was in Oregon, and it was 113 degrees there for 4 days straight when they had that heat dome. And apparently there's been more of those since I left. And that's just insane. I've lived in Central California before. It wasn't like that.
Right. Wow.
You know, but actually, you know, I didn't really mean to call in about climate and climate change. That just kind of happened to be what we were talking about at the time. Wanted to say, first time caller. Love the show. Been watching you on the Majority Report did someone say the M-Majority Report?
I didn't catch that.
Yeah, someone said that in chat. They're just having fun. But always love the things you guys do. Miss Michael, rest in power. I will say this: the first place I ever heard about ivermectin was Dr. Pierre Corey was on TMBS. Leisha had him on right after Michael passed, and I was, you know, that show was still going, and he did like an hour and a half, and he actually had some insight into you know, how what happened to Michael. Because, you know, Michael had a couple of genetic defects that the two of them conspired to. I wonder if he could have had, if he could have gotten wild hair up his butt a couple years before that and gone and had gene testing and going, hey, you're going to have an aneurysm. You need to get that fixed, buddy. Or whether they wouldn't have even known, but they were able to determine it afterwards, Just so freaking horrible. That guy seemed pretty legit to me. But then again, you know what? What works in a petri dish in a lab, petri dish, doesn't always work in people's bodies, I mean, they have a thing out there that should kill every virus, but it's never made it out of the lab. Works great in bunnies, actually, But then again, you can freeze and thaw bunnies too. That's actually how they came up with microwaves.
I don't think Dr. Cordy was on TMBS though. The guest that I had on was on TMBS. Dr.
Pierre Cordy was on TMBS at about this time last year.
Are you sure? Because I'm looking. I don't see.
Swear to God. It was right after Michael passed. Because the
guest I had on today has been on TMBS previously.
Yeah, no, because I've seen him on places, past that, and I'm like, oh, come on, man, what are you doing on freaking what is that, Iron Horse, Dark Horse,
right?
Yeah, it's like, I thought you were legit, man, and then I don't know.
Yeah,
I don't know, but
it's weird, man. I don't know why people it's so weird that you would like attach yourself to something like this. Like if you're a medical doctor, it seems like you just go where the science takes you, right? I mean, the idea that you would not do that is baffling to me. But
I think that was where the science took him, but yeah.
Right. The science took him there, but he's not updating himself with what's the current situation.
Well, and also, the narrative is helping fuel this anti-vax stuff. I mean, my mom is scared to get a vax. My little sister, who's 45 years old and a diabetic and thinks that she's going to have a kid at some time, is scared to get vaccinated because it might do something to her uterus. Now, I mean, on one hand, she's kidding herself. She's 45, but Yeah.
Oh boy. All right.
Yeah, I mean, it's crazy out there.
Yeah.
But just everybody keep your heads up. I will say one thing. Some of the research that I've been seeing is saying that because of the structure of the virus, there's only so much you can do as a virus. I mean, viruses mutate all the time. That's part of the thing about them. They mutate all the time, but most of those mutations don't make it, or they have the mutation and then just the delta is more virulent. So, I was going to have beta, but delta took over. So now only delta shows up,
Right.
But basically the guys that are really good at the genetics are saying it can't really mutate too much without becoming something completely different and still have the spike proteins to where it's able to get into the human body. And the spike proteins are what we code the vaccines against. So,
Right.
Yeah. So that's my one. What's the opposite of a black pill? I don't think it's a red pill.
A blue pill, maybe? I have no idea.
White pill. Well, the red pill is you see the truth. The blue pill is you wake up thinking nothing happened. So I don't know. I don't know. But that's the one bit of sunlight there. Get your boosters. We should be able to get through this.
Yep. People should if you haven't got vaccinated, obviously don't jump ahead of yourself. Talk booster. You just get vaccinated, please. Thanks for.
Actually, I watched Dr. John Campbell, who's from the UK. He's pretty legit. But the one thing that he said, and he does a little thing where he just goes over some things every day. He had a real good thing on the effectiveness of booster doses, and he always has guests on. And basically, at this point with Delta, you're going to get it in some form. You're going to be exposed to it, and you're either going to get sick a little, you're not going to even know that you have it, or you're going to get really sick. And the vaccine reduces the likelihood of all of those things. So
right.
I doubt there's anybody here that hasn't gotten their vaccine, but if they haven't, get it, man.
Now's the time.
Okay.
Thanks for the call.
Left is best.
Left is best.
Bye.
Bye. All these first time callers, I love it. We got another caller right away. What's your name? Where are you calling from?
Hi, can you hear me all right?
I can hear you just great.
Hi, my name is Sophie, and I am from Indiana.
Hey, Sophie, what would you like to talk about?
So, one thing I want to say is I think you're doing a really good job promoting like pro-vaccine movements and all that stuff. My father is a huge anti-vaxxer, and it is so hard to break down and explain to these people that you're just wrong.
Right.
I come from my whole family is very conservative, and I love them, but it's very hard to debate with them on anything. They're very critical about anything you put up, anything that really need hard evidence. They have something to refute it with. So for the longest time, I was a very conservative person. I took the red pill, quote unquote. So it's really hard to convince these people that what they're thinking is just totally wrong, come from a wrong place, and it's killing a lot of people. So I just want to say thank you for putting yourself out there and talking to people and talking to doctors especially, because I had no idea about the whole ivermectin thing, and that it actually came from at least a little bit of sincerity, but it just gotten blown out of proportion. So it's super cool to actually learn what's happening.
Oh, thank you. I really appreciate it. Now, with your dad, how did he? Do you know how he? Is he political? Did he? Does he have his favorite right wing talking heads that he listens to, or he's just constantly on Facebook and he's got friends?
No, he hates Facebook. He hates Mark Zuckerberg, all that stuff. He really likes InfoWars, and I like InfoWars, but I like Alex Jones because he's insane and it's hilarious to watch him.
When did he get into InfoWars?
I don't know, but it was when I was younger, because he used to talk about Alex Jones, and I regrettably used to watch Alex Jones back in high school.
If you don't mind me asking, how old is your dad? You give a range if you don't want to give an exact.
I'm 21, almost 22, and he's 54. Yeah, he's old.
Wow.
So yeah.
I'm 35, so I'm halfway to old, more than halfway to old. But
you look mid-20s. You look fine.
Thank you, I appreciate it. But that's very interesting that he's an old time InfoWars listener.
I can imagine he's been listening to it forever. I imagine 2015, 2014, but he's really big on them.
Okay.
But he's just always been on the conservative spectrum. When I was a kid, he would call Democrats the devil. I try to ask what liberals are about. He was like, liberals try and limit your freedoms and take away your money. And I'm like, well, that doesn't seem like actually what liberals want. So I did a lot of my own research as I grew up, and I wouldn't call myself a socialist, but I'm a lot more left-leaning than my father.
How does he feel about his child becoming a lib?
His trans daughter, not a big fan of her being a socialist or lefty or whatever.
How is he? I'm sure there's a lot for him to deal with.
Oh, it's a mixed bag. Oh my God, it's a lot. He doesn't know I'm left leaning, but I talked to him mostly about it. And I just kind of yep, no, those libs, they're insane, man.
Right. Well, it sounds like though that he seems like you're his kid, and you're not talking. You're not discussing him in terms where it sounds like you guys don't communicate or anything. So it seems like he's accepting. Am I wrong? I hope I'm not wrong. But
no, he loves me, and he's very sweet, but doesn't call me about what I want to be called. And I understand where his conservative values come from. It is a genuine place of caring, and he genuinely thinks he's doing a good job. He's just not. So I think one of the biggest problems is when people go to debate conservatives, is that they go in thinking that conservatives are all evil and the devil and they're all Nazis. When it's no, they're just, a lot of them are misguided. And obviously there are a lot of conservatives who are bad people, but I would say the vast majority are just people who, don't know the full story. And, no disrespect, I have conservative friends, love them too. Just alt-right stuff, it's very hard to, debate them and treat them like human at the same time.
I have friends. I have friends who are conservative. It's really hard to see them as human.
No, I love them. I just, it's ugh, I don't know about that policy, man. That seems a little bad. No,
see, listen, I'm actually, and I know there's I didn't plan on getting into it, but maybe I'll talk about it. But the thing between Chelsea Manning and Glenn Greenwald from earlier on Twitter, I don't know if you've seen that, where she basically said she wishes she was never friends with him, and she disavowed her friendship with him or whatever. And he basically said some horrific things, personal things about her, and basically attacked the idea that you couldn't be friends with someone who believes in things that are different than you politically.
And I mean, as long as it's not extreme, as long as someone's not like a Nazi, I'll be friends with anyone. I don't care what they believe, as long as they're respectful.
Yeah, sure. But I mean, like, to me, politics isn't the same as like having a disagreement with like a favorite like band or type of music or movie, or like if someone believes in a policy that would hurt you. Then I mean, I could totally understand why you would not be friends with them. I mean, it's just a bizarre. To me,
it's complicated. Obviously, like that stuff isn't like a really, really bad policy. Like for me, I hate people who hate limiting voting and aren't okay with like mail-in ballots and say like, oh, it's to stop illegals from voting. I'm like, well, that's just not true. That's like a really big deal for me.
Right.
I just like that would piss me off. I wouldn't want to be friends with someone who thought that, but none of my friends who are right-leaning believe that.
Right.
So I think it's everyone's got their own like stopping point where it's like, this is messed up, we can't be friends. I'm probably a little bit too lenient about things for the most part, but I try not to get confrontational or talk about politics with people I'm not super comfortable with. Even like my partner, they're pretty left-leaning too. We both talk and we're both good about things. We don't agree with everything, but we're still civil about it for the most part. They can't see me. They're drawing.
I mean, I feel like, if we're talking about someone who isn't too political and, they're not part of the political bubble, they're not constantly talking about it. They're just someone who, they go out and vote and that's that. I mean, they should understand more about their views and why they have them. But that I get, like normal people who just go about their daily life, not really thinking about politics. I could understand, letting that slide because they're not like steadfast and true believers in their, in their stance. But if you have someone who advocates for Republican policy, is a right-wing activist, I mean, to me, that's a little bit different. I mean,
yeah, most of I have a couple friends conservative. Sorry, I keep talking about it, but a lot of them aren't super socially conservative. They don't go out and talking about it, but they believe in some policies. They vote for certain people, but they're not they're not going to go out and like to a march or anything or like scream like we need to vote this. They're like, I like this candidate.
Like
whatever.
the blue collar construction worker, paying no attention to politics, and then he hears what people saying about Trump, and he's like, oh, I like what that guy's saying. I bet he's gonna save my job. I'm gonna go vote for him, and he votes for Trump. That's a guy I could see letting that slide if you want to maintain your friendship with him.
Yeah.
Someone
that
who's
dude's not evil. That dude's not trying to destroy the world or destroy
right. He unfortunately has been duped himself. It seems like. But if we're talking about the guy is listening to Nick Fuentes every night, then friendship over. You know what I mean?
Yeah. If you're watching Steven Crowder every day, I'm sorry. I just don't want to be friends with you. And I'm calling out myself here because I used to listen to Steven Crowder.
So you're someone who was a concern. Your dad had got you.
I was total right wing MAGA BS. I cringe.
Ooh, so you were. I forget that you said you're fairly young. So
I'm 21. Yeah.
Okay,
so I
mean that's young, especially when we're talking about 2016 and you being like a teenager.
Yes. To be fair, I think everyone my age was conservative and, haha, SJW. So it's just kind of one of those.
Yeah, that is something that I need to look at more. I think that's been very undercovered, how there was a whole. Like millennials were
super right-wing all of a sudden, and then they just swinged around super left. Or Zoomers, sorry.
Zoomers. See, this is what I'm talking about. I actually think. People say that like every generation gets more progressive, but Zoomers had a point where they were actually more conservative than the millennials. And I think that's been really not looked at what happened there. Now I think it's evened out more so now. And I think
maybe from my bias, I'm biased here, but from what I've seen, I think a lot of Zoomers are a lot more liberal than their fathers and mothers and all that. There was that dip where there was a lot of conservative Zoomers. You know, I was
Right,
part of
right.
that when Trump got in office and all that. And I liked Trump. I thought he was cool. And then I moved out on my own, moved in with my partner, and then, you know, did a lot of my own research. And I'm like, wow, his taxes suck. These just hurt everyone but the upper class. And, you know, actually thinking for myself and not having my dad in my ear, I'm like, wow, I believed in some pretty racist things, and I had to really think about myself.
Could I ask you what was the what was the moment? Like, what was the change? Like, was there maybe there wasn't a moment, but what was the catalyst? Like, what?
So around 2018, I would consider myself like centrist libertarian, and I can still consider myself somewhat libertarian. I'm pro gun, I'm pro drugs, all that stuff. I'm the, you know, social libertarian, if that even exists. So that's when I started changing. I think 2019, late 2019, I started Hassan Abi, and I started watching Vosh a bit, and I really listened to them. I did a lot of my own research. Philip DeFranco. Phil DeFranco used to be a little more right leaning, and he's definitely moved towards more progressive stuff. And he's all like three of them really like changed my kind of worldview and made me like see the other side. And I'm like, wow, all the things I believed were like kind of racist and kind of like, you know, pro-capitalist, and capitalism isn't, you know, the best.
Was there?
It wasn't any. You can.
You know, that's really interesting. So were those YouTubers what helped? Well, when I say YouTubers, I mean obviously I mean the whole, you know, online sphere of leftist talkers, podcasters, video makers. Were they what pushed you there, or did you get there from, like, how did you get to them? Is what I'm asking.
So for me, it is like it's like a leap, kind of like not a leap per se, but like a bridge. It's one thing to the other, slowly coming over. You start with like the super, you know, right leaning stuff, and you slowly push over into like more left leaning, more centrist stuff. I wouldn't say there's any specific thing. It's just a lot of even a lot of creators on YouTube were a lot more left leaning, and I think YouTube as a whole has changed into a more left leaning platform, at least for creator standpoint. So I think that also helped. There wasn't any specific moment of like, oh, capitalism bad. It was just a slow growth of me, you know, internalizing what I've seen and thinking about it. A lot of days in the shower, I'm think for 30 minutes, and I'm like, this doesn't make sense, and I just think about it. I think a lot. You know, big brain. But I want to understand things, and I want to, you know, try and understand them. And, you know, I'm not the most politically knowledgeable. There's a lot of things I do not know, but I want to learn. But, you know, it's just, I try and learn a bit every day, and trying to look at my biases, and I'm like, do I like this person because their views are good and what they think is good, or do I like them because I'm biased?
Right. Right.
It's hard. Right. It's super hard to do.
Thank you for sharing this. This is very, very interesting, and you made me, you know, I've been thinking about this for a while, and I sort of maybe like the past year or two, I've sort of forgotten about it, but there was that weird stretch in like 2014, 2015, 2016, where there were a lot of Zoomers who were yelling and whining about SJWs.
It was the SJW feminazi thing, the red hair. I don't know what it feels like a hazy memory when I look at it, and I really wish someone would make a documentary about it, or like a, you know, an interesting video like explaining it, because it's super weird looking back at. And I think a lot of it's just edgy teenagers thinking they're funny, voting for Trump, and saying, haha, girls suck and all that.
I think Gamergate had a huge part in that.
Yeah, I really didn't know much about Gamergate. I thought it was cool, and then I really did some research on it. I'm like, oh, wow, this is awful. Oh, my God.
See, you didn't even have to be knowing what was going on for it to infect your thought process, because you said you weren't really following it, but you were aware of it. I mean, obviously that shit was seeping. Like, you know, for example, I see so many people on the left fucking retweeting since like 2020, when she became like all of a sudden the biggest Bernie Sanders supporter, fucking that YouTuber Shoe on Head. And it's like,
I love and I hate Shoe on Head so much.
And it's like,
she's so dumb but so funny, and I just, oh my God.
Well, I'm not gonna. I don't know about.
She's cool. She means well.
No, I don't think so, man. You want to talk? You know, I want to.
again, maybe it's the bias in me, and I need to like articulate and think about that. But I don't know. I think she's okay. She has some bad views, but I think that's as leftists and as people who are trying to better the world, I think it's good to challenge her on things and good to challenge everyone on things and grow. But also probably biased, and I just think she's pretty.
Right. Well, yeah. I mean, she's sure she's good looking, but I mean, the idea that she didn't play a huge role in, like, you're telling me, for example, like, I'm hearing from you, like, what you're saying to me is I'm hearing like, okay, she's saying that people need to look into what's going on, what happened in that like weird time frame where SJWs were all the Zoomers cared about, and they were anti-SJW, feminazi. But then you're also telling me that, like, Shoe on Head is great. Shoe on Head's a big problem in that whole thing. She was a major part of that.
In a way, I think she helped de-radicalize me because
Okay.
while her things are like, cringe compilation, anti-SJW, and that's not the best, she still is a leftist and has mostly left-leaning views. And when I looked into her, I know.
Did you see that she just joined some right-wing organization?
She did what? She did what?
Yeah, she.
Oh my God! Someone in chat just come over and shoot me. I feel like an idiot now.
She is
What did she do?
I don't know what this thing is, but I saw it the other day. She was announced as the. Where is this? Was it deleted? Did they remove her?
To be fair, chat, don't hurt me too much. I've been sick for a week with an ear infection, and I haven't been on the internet. So.
She was announced to work for the New York State Populist League, an organization that just endorsed Curtis Sliwa for mayor of New York City. I mean, it's weird. I'll tell you this: it's weird that all of a sudden any tweet that I saw announcing her as part of the organization has been deleted. Maybe she saw the blowback from it and backed off. But I don't trust her. I never did. If she wants to convince me otherwise, I would love to talk with her, honestly, because I would love to talk to anybody.
I would love to see a conversation.
But she strong Cassandra Fairbanks vibes from her, to be quite honest. She went in reverse as Cassandra Fairbanks, but I remember when Cassandra Fairbanks was hardcore Bernie supporter. I remember her back from like the Occupy Wall Street days. Something always felt very off about her to me, and so even when she was a leftist, which she was first, or claimed to be, so it wasn't like there was some right-wing background to her that like threw me off. She was like a left-leaning person to begin with. Something did not sit right with her to me, and so I never shared her stuff. I stayed away from her. I didn't say anything because I wasn't sure, but for me personally, it was better to back off than to engage. Unless she wanted to engage with me, I would have been, again, happy to do that, but I never put myself in that position. She gives me those same vibes. I think something's off there. I'm sorry.
That's valid. That totally sours my taste on her now. I don't know. I do not like that. I guess any
of these people who came out talking about SJWs. I mean, there are people like you who totally have come completely around.
But there are totally people who have been radicalized by her. I know for a fact.
Right.
I've seen people who like Shoe on Head and are right wing. So I think it's one of those things where it really depends on the person. Because same with someone who named Chris Reagan. Chris Reagan's very socialist person, but kind of was in the whole anti-SJW thing.
Chris Reagan was one of the biggest people who I had a problem with during Gamergate. The guy was a horrible person. There's no coming out to me. Listen, I'm going to be honest. I'm not going after you. You're actually firing me up, not because of what you're saying, but it's bringing me back to those days. There is no coming back for those people without a complete turnaround, apologies, a complete turning down everything they need to completely. And there are people who've done that. I have not seen that from Shoe on Head. I have not seen that from Chris Reagan. So to me, they are the quintessential people who you do not trust because there's something off about them. They're just following whatever they think they need to do to keep their little Zoomer fan base. I don't trust them because they never did the turnaround. They never did the work necessary to fix the problems they caused. So, I mean, I think they're honestly, until they do that, they can go fuck themselves, to be quite frank.
for Chris, for me, I agree in that Gamergate was really bad, and I think he was kind of the contributing factor with how bad Gamergate, made it, or how good it made that he made it look. And I guess he's went on record, and I've heard him say that he's apologized about it, but I think he needs to do like an actual hey, this is pretty messed up. You guys need to not follow this. Because half-ass apology in middle of the video about it, I shouldn't have covered Gamergate. That was really bad. Doesn't stop the probably thousands of people you've radicalized.
I mean, Chris Ray Gun was a huge part of that whole thing. Like, he was like, I got into the Twitter things with him. He sent people during the game. He sent brigaded me and shit like that with his followers and shit. Like, I don't care about that shit. I live for that shit, to be honest. So I love that he did that. But I mean, the guy was deep into it. He wasn't some sort of vague passerby or something. I mean, Lacey Green, isn't that her isn't she going out with him or something? Yeah. She's one of the people who they all hated because she was such a strong feminist SJW. She goes out with him, and all of a sudden she's turning her back on that whole world. I mean, to me, this was all a grift for all of them. These were all grifters who found their little niche. Her too. She found her little niche. Okay, it means someone who basically is chasing the almighty dollar. It doesn't necessarily have to be like a money play. For example, if you have a fan base and all of a sudden you realize that you get a bigger fan base by doing something else, you go that route. I mean, we're seeing grifters all the time. They go, it's super easy right now to do pro eat your ivermectin horse paste shit. If I wanted to do that. If I wanted to do that episode instead of the episode I did, I could tell you right now, I would be raking in the Substack cash.
Well, you get banned too, but
Substack, you're all good there to do that shit. I mean, I think.
Sorry, I feel so young.
No, I'm really glad you called because it's bringing up some things that I haven't talked about in a while, and I'm glad we're talking about this.
I did not know how bad it was with Chris Reagan and Gamergate, so I apologize there. I did not know.
No, it's good because that's the thing. That's how they got you guys, man. You were.
I know. I got radicalized.
I also wanted to say I'm sorry. I keep saying man. That's my normal. I call everyone that, so I'm sorry about that. Dude, I do that all the time. I say dude, man to everybody. I apologize.
No, dude's fine. As long as you aren't calling me he, I'm not gonna, throw a fit.
I'm gonna really try to stop doing all that because it's bothering me. I'm sorry for doing that. It's just a bad habit I have. But to me, the idea that people in your age group grew up and thought this was they saw the people that they watched. Zoomers grew up with these YouTubers being the same as Hollywood actors. I missed out on that. We're close in age. We probably have very close politics, but culturally, there's a huge gap in how I view Hollywood celebrities and people on YouTube, no matter how big the YouTuber is. But for Zoomers, they view all these people as the equivalent. There's no difference between a Tom Cruise and a Ninja or a PewDiePie. They're the same in terms of whoa, these are huge superstars.
As I don't watch PewDiePie anymore, but I definitely think he helped radicalize people. Not on purpose.
I'm just using these names as placeholders. I'm talking about I'm just talking about a big YouTuber people, or a big Twitch streamer is the same as a Hollywood megastar to people your age. Am I correct in saying that?
I'd say, yeah. I think for people my age in their 20s, for sure, people, YouTubers are a lot, really cool to us, and we look up to them for the most part. I'd say I don't have that symbiotic relationship with YouTubers where I latch on to them and I just I'm best friends with them. When I've watched a YouTuber, I don't really, get that connection. But for a lot of people my age, it's like that. I think with the younger generation.
Just to stick with what I was saying though, because I don't want to lose track of what I was getting at. Mm-hmm. So people in your age group, in your teens, you're watching these YouTubers. They're getting insanely big. You're developing relationships with them online. I personally, again, I'm in an age group where it's harder for me to do that. But I get that, but so you're developing these relationships with them. You're trusting them. You look at them as someone you know and trust, and they're pushing this shit on you. And I see it today, actually, where people who are under the age of, I don't know, whenever it was too young to really know the political ramifications of Gamergate, are remembering it as something that it was totally not. And it's so bizarre to me because, I hear people talking about Gamergate like, oh, wasn't that the thing where like a bunch of people wanted to ban video games, or like journalists were in cahoots to give good reviews to bad games or something like that. And it's like, whoa, like where are they getting this from? That's not what it was at all.
What I know from it, and just from that perspective, I don't know really anything about Gamergate. I don't stick my nose in it, but from what the right wing thing of it is that video game publishers were sleeping with ADHD brand. I can't think of the word. People who write video game reviews or something like that, and making the reviews better or something. It's been years since I've looked at Gamergate because I'm so soured on it, and I'm like, ooh, my politics are bad. But it's weird because I don't think I really even knew what it was, and I still don't even know what it was. But I thought it was this stupid, evil thing, and it was like bad. And we like, YouTubers have such influence on younger people, and I didn't see it younger or when I was younger, but I see it now, and it's really dangerous. Because it is a lot easier to fall into the right wing rabbit hole with YouTubers than it is the left wing. And it's super easy to become radicalized, especially when you're younger. Right. Sorry if I'm repeating myself.
No, it's
a little anxious. This is a lot of people here.
Listen, I'm someone who literally runs a show where the point to me is to help people get. Oh, look! I found this old tweet from Chris Raygun, March 26, 2015. As the days go by and weeks settle into months, at Matt Binder remains the slimiest of cunts anywhere on the internet.
Oh God, no. That's so
bad. March 26, 2015. What was this about? I fail to see how characters in games being less popular than it. Oh, okay. So he had a problem with what I said, where basically there was an article in the Huffington Post, I think it was, talking about how Nintendo is really bad when it comes to female protagonists in their video games. Now, this is a completely legit argument. This has been a long-running criticism of Nintendo. And in 2015, probably even more so. I don't know where they've gone since. I've had kids since this time period, so I haven't played as many video games as I used to. But for example, who's the first female character? Are you a gamer?
I love video games. I don't know much about Nintendo.
Okay, but maybe
first female video game character that comes up would be Zelda from The Legend of Zelda.
Who's the so Zelda? Okay, she's not even the main character really.
No, she's not. I guess Bayonetta, but I haven't played a single Bayonetta game.
See, for me, Bayonetta, and this was an argument I made then, Bayonetta was one of the names that people brought up to say, how can you say this? Nintendo has Bayonetta. And I said at the time, if you can name a female character in the mainstream from Nintendo, you could really only name Zelda and Peach is a horrible example because when she was she's a damsel in distress, and when she's the main character, one of her powers was to cry. I mean, come on, this quintessential Nintendo being bad at portraying women in their video games.
Yeah.
So, but my argument was Bayonetta is not a known character to a mainstream audience. If you were not, that was a controversial thing, and that's what made someone like Chris Raygun come at me and think I was a huge piece of shit. This was something that
it's reactionary. All they're doing is reacting and like trying. It's grifting. That's all it is, and it's. It's weird to look at it now and realize it's all just a grift and it's all just to like get clicks. But, as a kid, as a 16-year-old who's like, struggling with like depression and who they are, it's really easy to see videos and see people making fun of other people. And it's like, haha, that's funny. I feel better. And I think that's a lot of what the younger generation does, or a lot of people who are insecure about themselves do. And it's a lot easier to, fall into that rabbit hole.
Right. I mean, as people in the chat are saying, bringing up Samus from Metroid. But here's the thing, too. Samus, you ask mainstream non-gamers, like people, when we talk mainstream games where Nintendo has a problem with, we're talking household names, people who aren't gamers,
Mario,
Mario, Donkey Kong, people like that. Even in, you could even think of other systems, PlayStation had Lara Croft. I would say most people know Tomb Raider. But for Nintendo, I would wager to guess that even if you knew Metroid, which is a pretty big video game, I would say a lot of people don't know Samus is a girl. To be quite frank, it's not quite clear for a mainstream audience.
It's false either.
Right.
I haven't played. I'm be real with you. I really don't like Nintendo games. My last ex-boyfriend loved Nintendo games, and he really weirded me out with it. And anyone who likes Nintendo and like the Sonic type stuff, I don't know. They always weird me out, like the fanboys. But I don't know much about Nintendo games.
Right. All right. Well, we can move on from the games. I really appreciate the call, though. I was first of all, I'm very appreciative of all the topics we talked about. I'm glad you fired me up because I had totally forgotten about some of these people. I'm
glad I learned a lot from you because I did not know a lot, and I feel like I have to think about a lot of stuff that I didn't want to.
Now, listen, I'm someone just to end it on this. I'm someone who does a show that also pushes that the point of doing this, to talk about this stuff, is to get people away from it. You were someone who said you were a conservative and you came around. Now, I think that's great. I think we should welcome that. If you are, I've extended that to when I cover white supremacy and white supremacist organizations. A major reason for doing that is to bring people who are white supremacists out of it. A lot of especially young white men fall into the white supremacist rabbit hole because their lives are shit,
easily.
And they get tricked into scapegoating some other, and they fall.
There's
into
a really
it.
good video called "How to Radicalize a Normie," I think it's what it's called,
right?
Or the alt-right playbook, something like that. And it is a really in-depth video on how people, go to the right-wing stuff. Seen it several times. I've seen it with friends, and it's really good. I highly recommend showing it to anyone who's falling down that right-wing rabbit hole, and it'll really change their perspective, and challenge them on their beliefs. Don't just sit there and let them think stupid stuff. Don't be a dick about it, but be like,
right.
Hey, I don't agree with you.
Right. But
anyway.
the reason I brought that up, though, is because I just want to make sure I mention I'm always for people coming out of it and full bore, welcome them in. There's plenty of conservatives. We have a whole array of people who contact the Majority Report and then myself saying, I was this and now I'm not. And I love it. But for me, people like Shoe on Head, people like Chris Raygun, people like Lacey Green they've not done the work to be in that position to say all is forgiven. You have come around. I don't believe it for a second with the three of them. I think they would switch like that for the next thing that came along on some right reactionary position that they could hitch their ride on. And I will take that to the grave until they actually make amends for what they've done. I'm not saying they have to grovel or anything like that, but they owe it to their audience to explain how they were wrong in depth, explain how they were completely wrong in depth, and to explain how to, not just say I was wrong. They need to go into what they sold to their audience and come to terms with the vast amount of harm they've caused to people like you. That's what it's all about to me. People like you who were growing up during that time period, who could have gone a whole different route if you continued to follow people like them. Luckily, you thought otherwise, and you came around and got out of it yourself. You can say Shoe on Head helped. I'm glad that is the case. But
I like to imagine she helped. Maybe I think that's a lot of bias in me because, I think she's cool and I think she's funny, but also
I saw her propelling that whole fucking cultural puritanical outrage over that stupid Netflix movie just this past September.
What movie?
The Netflix movie Cuties. Do you remember that whole conservative outrage over the movie about the French movie about the young children, the children dancers?
I heard it was a good movie, except for the fact like the crotch shots and like the weird poses and all that. And I really do not like sexualized kids or anything like that. Even if it's pro, I don't want to see anything like that.
You gotta. I mean, I watched the movie because I was interested in seeing what the whole hubbub was about. It's not typically this. I'm not even talking about a movie about young children. I mean, a movie about dancing is not up my alley to begin with. But I also haven't seen Magic Mike or all those like street. What is it like? With the movies with the dancers in the streets, like Step Up. That's not my style of movie. But this actually was a very good portrayal of what that community, what that industry projects onto young children. It does not sexualize them in any way. It is meant to really shine a light on how they see themselves. And to be quite frank, the children, and this is probably very true, they don't understand what they're doing, so they don't see it as sexualized. And it's then to show how adults see it. They do it, so it's not from one side either. It shows how adults see it. And it is a very good portrayal of how it probably feels as a 10, 11, 12-year-old child, young girl growing up, and a lot of them are in those dance worlds. And I've listened to reviews from dance teachers who've said, and they're not necessarily political, or you look on YouTube, legitimate like dance teachers have come out and said this was frankly the most realistic portrayal of this world I've ever seen. It is frankly a good movie. I've seen it once. I'll probably never watch it again, but the whole hubbub was a right-wing, puritanical effort to find some cultural issue to latch onto and try to start some sort of issue with Netflix and cultural, they always do this in movies. And the hot topic, obviously, is pedophilia. Right away, mention pedophilia. Someone's a pedophile. That's it. I mean, I had someone, because when that movie came out, someone who I was friendly with on Twitter, who has appeared regularly on the Chapo Trap House video game streams, literally cut me out of their Twitter world, of their online world, because they thought it was weird that I would defend that movie. This is someone who was a leftist who was taking part in the right-wing cultural outrage machine. That's how easy it is for people to fall for this shit. I mean, the idea that you would get involved in this right-wing outrage over a fucking movie is absurd to me. Absurd.
I will have to watch the movie because I will be 100% honest. I do not have an informed opinion as well as I thought I did. Yeah, I have not seen the movie. I've seen bits and pieces. I've seen the bits and pieces that make me uncomfortable. But
well, it's out of context, of course. You have to,
context for sure.
Right.
So
listen, could they have done the movie?
I will give it a try for you.
I mean, the movie was directed by a French woman. It's not like it was like some like weird, creepy old guy who's directing a movie. Like, she wanted to create a movie that shared her experience growing up as a young Muslim woman. I believe the character is Muslim. The main character is Muslim, and it's frankly a good indie movie. And I would have probably never watched it. It would probably never been come on my radar if it wasn't for this whole hubbub. So it's amazing.
I will agree. It was definitely blown out of proportion. Like, holy crap, everyone was covering it. Like, oh my god, guys, please stop. I do not care about this movie as much as some people make it out to be.
Right. But that's something that also has to be looked into. And I've noticed that basically we are now in a scenario where, because there are actually legit pedophiles out there, the Jeffrey Epsteins of the world. And then there was this whole recent, I don't know if you've seen this online.
Have you seen the maps on Twitter?
Yes. Now there was that whole thing with that Prostasia organization. Have you seen that? Protasia or something like that. Now listen, those are, and I'll get more into that in another episode. I'll probably do an episode about that. Those are not, to me, like moral outrages, or I think there are legit issues there where there are people legitimately trying to normalize the sexualization of children, and that's gross, and that like it's like modern day NAMBLA, you know what I mean? Like that's not
Also,
cool.
from a person who's in the LGBT community, it is also really terrifying seeing like people trying to normalize pedophilia because they want to wrap themselves in with us and like join on our band, and it's really hard because we have to make sure it's known like these people aren't part of us. So I cannot stand maps. I cannot stand pedophiles, anything
Right.
like that.
I don't think.
Oh my
I don't.
god.
But I mean, I don't think anyone stands them. I mean, that's the thing. Like, as a society, we have completely all agreed for the vast majority that pedophilia and sexualizing children is bad and wrong.
And somehow that's controversial for some people. They're like, well, I'm like, no, there is no well. It's bad.
No,
it's gross.
I don't actually think it's controversial. I think there's a small, very small niche group of people who are very, very teeny tiny, honestly, who are not even worth talking about that are in that position. I don't think, like, really, I think that is a bad. That's what sort of gives the idea for these QAnon people to believe that there's some sort of giant pedophilia ring out there. Like, yes, there is child trafficking and there is pedophilia out there, but the idea that there is some sort of vast campaign to it's just that to me is where you get the problem, where people all of a sudden are becoming puritanical. If you told me when I was
look at Pizzagate. Pizzagate was a mess. Ugh.
If you told me, like, growing up that, like, the left would have been the puritanical people when it came to an independent film artfully trying to get a legitimate point across, I would be shocked. I would be shocked because it means they fell for the religious rights, bizarre issues on current American culture. And I think it is not, like, there is a way, and it's not like it is, and it seems to me the right, like, it seems to me the completely normal way is to realize that pedophilia, child trafficking, these things exist. They're bad. As a father to two young children, I obviously care about those issues because I could never imagine if someone did something to my kids. And I'm someone who feels that way when it, I'm not someone who's also just like, oh, when it had to happen to me first. But when you do have kids, it does obviously hit close to home. So
I have a little brother, and obviously I don't have that parental
but
role.
It could still be the same.
If anyone touched my little brother, I'd kill them. Like,
right.
I would go to jail if someone tried to molest my little brother.
Right.
Don't care. Base.
So we can say that these things are bad and wrong, and any attempt to normalize this shit is disgusting. But we could also say that a fucking movie that tries to, and to me quite successfully, shines a light on problems and decides that to do so they need to, via actors. Again, these were all children who were professional actors, whose parents were there on set, whose parents agreed, who they discussed with the children the issues. I mean, if you look up how they made this movie, it seems like they made sure that these children had the level where they understood what was going on, they understood what they were doing, what they were acting. I mean, these kids were good actors. They couldn't have done. They could not have done this movie, honestly, if they didn't understand what they needed to portray, because they were not playing kids trying to act like adults grinding. They were playing kids who were being like, who knew, like, they knew that they were portraying kids who were being sexualized in a dancing capacity to shine a light on that. Like, they did not understand the topic and what they were portraying, because otherwise there's no way they could have done that movie successfully. You would watch that movie and be like, the acting is shit. These kids don't understand what they're trying to do.
I will have to give it a watch. I don't know if you're right or not. I don't want to believe you're right because you're very smart, but I'll definitely have to,
Oh yeah, of course. Don't take my word for it. All right. I really appreciate this call. We talked about a lot of stuff.
It's been on for a long time. Yeah, thank you for talking to me. You are, like, really interesting to talk to. You have a lot of interesting opinions, and thank you for de-radicalizing normies.
Thank you. Have a great night.
Have a great night.
Whew. I'm sorry. I was just super interested in talking to someone who grew up in that world of anti-SJW feminazi culture. And it was completely super interesting to me. I'll take one or two more calls. What's your name? Where are you calling from? Hello. What's your name? Where are you calling from? You are on the air. I can't hear you, but you're on the air. I'm going to let you fix whatever issue really quick. I just saw you mute and unmute. Check your audio settings. I'm going to give you another second. I got to hang up. Sorry. What's your name? Where are you calling from? Hold on. I can't hear you. What's your name? Where are you calling from?
Can you hear me?
I can hear you now. What's your name? Where are you calling from?
Okay. All right. Let me just turn up the volume so I can hear a little bit better. Hey, yeah, I called in a while back. It's Amy from Nashville. I've called a couple of times. Most recently is about the signs thing, the yard signs. But anyway, it's fun. You're talking to two trans women in a row, so that's fun.
Oh, there's one thing I've found out about ever since taking calls to the show is that I have a huge audience of trans women, and I love it. I love it. That's great.
Yeah. So my initial thing that I wanted to call and talk about was the thing from last week with Mark Levin and the Franklin School.
Good old Franklin School. I think that's the most hilarious thing ever. The fact that you would write an entire book on the premise of the Frankfurt School and not know the name of the Frankfurt School.
Well, there's like 2 or 3 conceptual errors that are going on there, and if I can, I just want to break it down a little bit.
Go ahead. No, go ahead, please.
All right. So the things that we need to sort of like tease apart here are, what's the, what is the Frankfurt School? What is critical theory? What is critical legal studies? And what is critical race theory? Now, I'll just briefly say that critical race theory and critical theory, unfortunately, though they're named similarly, have basically nothing to do with each other, although they're both part of the sort of same broad intellectual tradition in terms of being inspired by continental philosophy. Critical legal studies is what critical race theory is based on, and critical legal studies was influenced by postmodernism and specifically the post-structuralist school in France, people like Jacques Derrida, who are saying you really need to think about how people read texts and how they interpret them as not being something that's super rigid, something that's, but interpretation is a really creative process. And so we need to understand that people will opportunistically read laws in various different ways. And so we, as interpreters of laws, need to be willing to look at laws in more complex ways than just what was intended when they were written. So that's one thing. And then critical race theory was a way of applying those methods of analyzing laws to the issue of race. But critical theory, which is a much older movement. If anybody wants to learn more about critical legal studies, there's a podcast called Opening Arguments. They had a few episodes on it, like I think 501, 502, and like 511. And they break it down in much more detail. But one thing you need to understand about critical legal studies, it was actually explicitly hostile to Marxism in the same way that post-structuralism was hostile to Marxism. And so, but critical theory and the Frankfurt School is it's a much sort of older thing, because the critical theory was at a certain point kind of a euphemism for Marxism, quite broadly, like in the first half of the 20th century. And there were a bunch of theorists that were essentially trying to ask themselves, okay, so Marx was predicting, the revolution to occur in Western Europe, and it didn't. How come? What exactly is it about like the West that that made it so that this did not occur. And one of the things they sort of did is they picked up loose threads in Marxist theory about culture and really tried to dive in and say, okay, what exactly is it about the culture in the West that prevented people from acquiring like class consciousness or whatever? And your mileage may vary on how much you like the Frankfurt School. I think they're fun, but like in terms of in terms of what the theories that they were using or what they were producing, what impact they had. Yes, you do have Herbert Marcuse, who does stay. Okay, sorry, I forgot to say. They all end up coming to the U.S. to hide from the Nazis. And most of them end up going back to Europe. Herbert Marcuse does stay. And Mark Levin mentioned, although he pronounced it Marcuse, Mark Levin does mention Herbert Marcuse there. And this particular lineage that people like to draw. Matt Taibbi also draws this lineage in an annoying way to me. That you have the Frankfurt School. Herbert Marcuse was a member of the Frankfurt School. He stays in America. He influences sort of like American leftists, particularly Angela Davis. And then like people then like say he is somehow responsible for the modern Democratic Party and its ideas, which is weird. So Marcuse was one of a number of Marxists who stopped really having a lot of faith that the working class would become a revolutionary subject. He started thinking, okay, what other groups in the world have revolutionary subjectivity? And so one of the things that he ended up looking to was the student movement at the time and saying they seem like they're revolutionary, or looking at the civil rights movement and Black people and thinking, well, they have some revolutionary potential too. And people will then say that he is connected to this specific strain of thought that is later. There's a book called Hegemony and Socialist Strategy. David Griscom interviewed somebody who wrote about that on Left Reckoning a little while ago. But basically, there is this sort of similarity between those two modes of thought in that you're not thinking that the working class is going to be particularly revolutionary. And so then you sort of start looking for other revolutionary subjects and you come with this weird sort of fragmented group of disparate people. And it ends up being basically what we now call identity politics, not what identity politics initially meant, but what we now call it, which is, okay, you have all these disparate groups of people who have very different experiences, and we're just trying to get them into a coalition to get power. Now, Marcuse was another person who was losing faith in the working class, but that was something that was happening with a lot of Marxists and a lot of people on the left more broadly. And so, while you could point to specific people in the Democratic Party who are influenced by specific ways of talking about identity that some former Marxists had, yeah, like Levin trying to specifically trace the critical race theory today through Angela Davis and Herbert Marcuse to the Frankfurt School that fled the Nazis, yeah, that's not really a lineage that makes much sense. It's way tighter than it is in reality. It's really just that people like Marcuse and the Frankfurt School are emblematic of conversations going on the broader left at the time. That's the main stuff I wanted to say.
Right. Very interesting. I honestly didn't know a lot of that. Honestly, I wish that I had taken your call earlier because I feel like I'm already exhausted. So I don't know what else to say other than you definitely taught me some more very interesting information about that background. Thanks for that.
Yeah, I'm happy to do so more some other time when you have more energy. I do want to very briefly. We obviously don't have time to get into it, but I do briefly want to just make a couple of notes about the sheet one head thing, if you don't mind.
Oh, this is something because it's not as intellectually draining. I think I can handle this one. The other stuff my brain needs to be better shape, but this stuff I think I can handle right now.
Yeah, that's perfectly fine. So, I have never really been a shoe on head fan or anything like that. But I do find myself thinking she's not the worst of that crowd. And so partly this is because there's two main things. One is that, while Shoe on Head has never been anti-trans broadly, she was anti-non-binary people. And I know that when she ended up meeting up with Natalie Wynn at a VidCon one time, and Nat took her aside and talked to her in depth about what being non-binary means. And she reversed her position on non-binary people, in part because Nat actually broke it down in person, in private to her. And I think took down some of her videos that were non-binary people. And the second thing, she was interviewed on The Surfs a while back. And one of the things that she ended up saying that kind of made sense of her position a lot to me is that she said, I think what I disliked about feminism was actually me disliking neoliberalism. And she doesn't put it in the way I'm about to put it, but I think it was specifically that she thinks most all feminism is that kind of lean in, fairly like corporate girl boss feminism. And it was that kind of feminism that really irritated her and made her very hostile to anybody calling themselves a feminist. And I would assume that probably led her to be really uncharitable whenever like interacting with, in anything feminist, broadly. Now, I don't know if, for example, somebody took her aside again and said, hey, look, feminism is a broad and complicated tradition. There has always been a feminist criticism of girl boss feminism, specifically from a socialist feminist perspective. Like, I don't know if she would then tailor her public, statements about feminism accordingly. But I think it's possible. I think she's somebody that can be reasoned with. Just, I don't think, I don't think I've seen evidence that she's unwilling to change her mind about things.
I've just seen. There's a few things here. I agree. I'm not someone who says ever that there's no coming back. For her to be there's no coming for the first time. But I just she seems to have. From what you just said, let's take the non-binary video she made. Now, I'm not a fan of hers, so I'm not familiar with the videos you're talking about. But the idea that someone who knows nothing about this issue with this huge audience would make quite a number of videos about this topic, it seems, already rubs me the wrong way. I mean, I do this show every week. I have on a guest who will discuss an issue with me. If it's something I know a lot about, I get someone on so that we can, have a back and forth conversation about it. If it's something I don't know much about, I have someone on who is an expert so we can have a back and forth conversation about it. When we go to the second half of the show, if a guest brings up a topic, I will be quite frank with them if I'm familiar with it or not. I will offer an opinion if they're asking, but I will make sure that they know that, this opinion is based on what you're presenting to me right now, what I know about it right now. I'm not an expert on this or anything. I also am doing a live show, though. She has uploaded multiple videos about topics she knows little to nothing about, asserting a steadfast opinion about such issues that have gone on to formulate other people's opinions about these said issues. It is unbelievably harmful what she's done. If she knows that she did harm, then that's great. But I also think she still does do the same thing.
Certainly.
I mean, she was hanging out with fucking Sargon of Akkad. I mean, I'm sorry. There's like, it's like, you got to do a lot of work when you're doing that to make amends. I don't know. It's not, if she's doing it, then I'm not an expert on her. So, I'm not all that familiar with what she's done in recent years. I do know that she's become a Bernie person. I've seen some people that I like retweet her stuff, and I think to myself, what are they doing? Do they know what her background is? I just don't trust that she wouldn't drop everything that she says that she stands for. Once again, it's just, I don't trust these people because they haven't come across as sincere to me, even if they say they've made the changes. I could be wrong. It's just my opinion.
Okay, like without a doubt, Shu owes a whole lot more, broad, public, and transparent, change of her view in order to, have made amends, so to speak. And without a doubt, having made videos about non-binary issues when she didn't know much about them was intellectually irresponsible. All that I'm saying is that I just think there's something resembling hope for people like that. I'm again, she was not somebody that I follow,
right?
But just the two interviews that I've seen since her sort of like shift made me think there might be like a specific critique of feminism that or of like a specific type of feminism that is maybe drawing people to this kind of mindset. And I think okay. So let me give you a difference.
I know what you're saying. So let me put it this way. Like, I did a show today on ivermectin, a very controversial drug that's being used for COVID-19. Even though there is no science, medically proven in terms of data or papers that this is a legitimate drug. There are doctors who say they've seen good results from it. But this become a controversial drug because people are going out and buying horse paste and eating it when that's very not good. I did this discussion with a doctor who sees some good in ivermectin. There's no one who is walking away from this conversation I had with this doctor who is going to think that I said, go out and take ivermectin and don't get vaccinated. We were able to discuss the entirety of this issue and get into the nuances while still getting the big picture in there. I mean, she
discuss like the issue of the vaccine hesitancy in relation to this. I actually think there's a good comparison, and that's that there is buried in vaccine hesitancy a certain distrust of the pharmaceutical industry that is actually probably fairly well placed. Now, whether or not it is actualizing itself in a responsible way is clearly false. Like, vaccine hesitancy is bad, without a doubt. I mean, I'm autistic as well, and one thing that the anti-vax movement has spent a lot of time doing is demonizing autistic people. So, or at the very least, spending a lot more time treating their parents like they're martyrs rather than just, parents dealing with a child that the world is not built for. But setting.
I'll be honest. I don't buy most anti-vax. Okay, the old school anti-vaxxers who were like totally anti-vaccinations and have been that way for a long time, I believe they have that big pharma mindset that you mentioned, and we talked about earlier too with my guest. I don't buy that these new breed of COVID-19 anti-vaxxers who aren't tied to that movement before COVID, I don't buy the big pharma excuse from them. I think that's just something they hear, and it's a way that they put it out there. They just don't. It's become a political identity for them. They don't care.
Okay.
We're talking about the people who literally hate all leftists and socialists because they'd rather have businesses make the calls. I mean, I don't believe they're hesitant about big pharma for a second.
Well, I think that it's more that there is like a broader, there is a broader sort of like skepticism that exists, whether any individual person holds that skepticism as a conviction. I think there's a kind of broader skepticism in the culture that's being tapped into. Does that make sense?
Yeah, sure. Okay.
Yeah. And I don't think that like, I all I'm saying is that there might be something similar going on with the sort of like anti SJW, anti-feminist thing is that there might be a specific like latent critique that can be made, and the absence of that critique in the public square is partly why this secondary version is taking hold. Let me give like an example from my own life. So one of the things that always used to frustrate me about the anti-SJW thing is that they would constantly go on and on about how, oh, but aren't we supposed to also care about men? If you care so much about equality, why don't you care about men? And the sort of like standard response that most sort of like, feminist identifying or feminist sympathetic people would have to this is, there's plenty of like writings within feminism that are sympathetic to men and feel like, gender roles hurt men too. And, I just found it so annoying that you would just keep hearing anti-feminists say this kind of thing. And then as like, an adult and out trans woman, I started actually like having to read into various like anti-trans theorists and academics. And boy, howdy, does like anti-trans feminism say a lot of stuff that sounds very much like that. A lot of, isn't feminism about protecting women? And, isn't feminism about women? Like you see this kind of thing starting to be said, or you have, say, like, there's a woman named Janice Raymond who wrote a book called The Transsexual Empire, who's a horrible, horrible person. Her like thesis advisor actually would not, like, had to resign from her post at a university because she was not allowing men to take her women's studies classes, like her upper division ones. And it's like, I'm sorry, but if you have a man who's like voluntarily signing up for like a women's studies class, he's exactly the type of man who should be in that class.
Right.
Like,
right. But
I
do you
don't-
see the problem though with even like mentioning that? Like this is such a specific like that's just a specific like low bore like I don't think there's that much of that out there, to be quite frank though. Like
But Janice Raymond is extremely influential in the anti-trans movement.
okay, but I mean, if you're using, I'm unfamiliar with that person, to be honest. But if you're using that specific instance you told me, I like okay, say I'm someone who very popular on YouTube, and I go out and I make a video critiquing feminism, and my reason for critiquing feminism is because of that class. You don't think that is incredibly deceptive?
Yeah, no, that's most certainly not like a good thing. What I'm saying is that like there are like examples of people who call themselves feminists who push things that actually are described by some of these anti-feminists saying, shouldn't we care about men?
Sure.
And I'm just saying that like acknowledging that maybe like the absence of specific types of very public discourse, feminist critiques of TERFs, for example, the absence of that kind of more robust conversation about how gender roles hurt men too. Like, and I'm not saying that there's much we can do about that. We don't control the narrative, but I'm saying like, I think sometimes like more ammunition is just left lying around for these right-wing douchebags when there's an absence of a public conversation that actually addresses the concerns at heart.
Sure. But I mean, we can't be monitoring every little infraction here. Like, I totally get what you're saying. Like, that is where it comes from. But in the context of shoe on head, her, like, to me, it makes it even worse that she would go out and critique feminism based on a class where a single teacher decided not to allow men to like you know how absurd that is. Like it's ridiculous to even like bring that up to your audience in the context here. Like I would never do an
one.
But we're
like,
also
I'm talking about this entire literature about like or that like within that identifies itself as feminist that's specifically trying to be anti-trans that does say a lot of these like anti-male things, these things that don't acknowledge the possibility of say a positive masculinity. I
think you're conflating a little bit like this individual is a TERF is what you're saying, the person you're talking about.
Okay, which person?
I maybe I'm confused. I'm sorry. It's 1 a.m. here. You brought up there's someone who has bad views on transgender people. Is that the same person who you're talking about with that class?
Her like dissertation advisor, who was like one of the people consulted to write the book, is the person who wasn't letting men into her women's studies class.
Okay, right. Okay. So I feel like, obviously that person is no good for these horrible, disgusting views on trans people. But the idea that their take on feminism, like the idea that you would base your feminism take on them, though, is wholly I'm not saying you, by the way. I'm saying someone who would make a video on feminism based is wholly deceptive, because you would not make that video as a critique of feminism. You would make that video as a critique on TERFs, because I would never. Maybe I'm misunderstanding then. I'm sorry, but I think I'm sorry if I'm confused. It's late. I just looked and we're on hour 4 here now. I should probably no, because I think it's a good conversation. If you got to go, no problem. But I think that there's a way to. I guess we can't talk if the confusion's here. So this person who you're using as an example of bad feminism is also anti-trans, correct?
Yes.
You can't use that person, though, in my estimation, if you're using a critique of feminism, because, I mean, I guess if you were making an overarching video about feminism and you wanted to talk about TERFs within feminism, like as like a subset, sure. But the idea that you would base your take on feminism off of this TERF is deceptive, flat out, to me. I mean, it's just wrong.
We agree on that. I'm not talking about the people making the videos. As far as I'm concerned, they're mostly just grifters and opportunists. I don't have much.
But that's how this stuff gets out there. Like, I don't know this TERF.
There's always soil. That's what I'm talking about.
Like, I don't know.
There's soil out there because there are people who do have views that this criticism resembles, even if they're few and far in between. Like, they exist enough that, like, somebody who just says feminism as though there's only one thing called feminism. Feminist is concerned with men. Well, they're going to remember, well, I've seen a feminist who isn't concerned with men. So, like, that is broadly wrong. And I'm thinking like a nuanced conversation about like feminism being a complicated tradition with like internal antagonisms. Maybe not with that particular phrasing. That's probably a bit of an opaque phrasing, but like, positioning feminism as a more complicated like tradition than typically people do might have actually like disarmed some of these critiques of feminism that were being opportunistically, thrown. That's what I'm saying.
So I think the disconnect was you're talking about that this TERF is who influenced Shoe on Head, right?
I don't know if this TERF.
I'm sorry. In this hypothetical, the TERF is who influenced the big YouTuber, i.e., someone like Shoe on Head.
As in, like, they might have. Okay, I'm saying that somebody in the audience of somebody like Shoe on Head might have met somebody with views similar to this very influential feminist, Janice Raymond. And that, like, if they've met somebody like that, then saying feminism is concerned about men actually, like, feminism is concerned about how gender roles hurt men, like, that's not going to be very persuasive to that person who's actually met a feminist who doesn't have that kind of view. Like, we need to not talk about feminism like it's a big abstract thing that's internally consistent. Feminism is a complicated tradition. So, like, but like, that's not the conversation that's usually had in response to anti-feminists.
Right. I see.
Not real feminism, rather than saying, well, there's I'd relate this to Michael's critique of Islamophobia, Michael Brooks, in that, Michael's critique of Islamophobia was always, well, sure, there are some Muslims who are, radical in one way or another, but like there is no one true Islam. There's lots of Islams. And, if we're going to be talking about Islam in a like subtle way, we need to be like careful about who we're talking about. And I think that just like a similar response to anti-feminists might be warranted, that, well, there's no one true feminism, but you get a lot of people saying, well, that's not real feminism. It's like, there's a lot of people who consider themselves to be who consider themselves to be feminists who hold those views.
Right.
And like, we don't interact with them because TERFs tend to be, at least lately, a lot more cozy with the right than with the left. But like they exist, and I don't think it does us any good to deny that they exist.
Right.
I would take the Michael approach. That's what I'm saying.
I understand what you're saying now. I think we were disconnected on where we were talking about, because I'm more focused on the fact that that person probably wouldn't be there if it wasn't for someone like this hypothetical big YouTuber that they're obsessed with that we're talking about.
We could problem with like specifically blaming her. I just don't.
Oh no, I'm not.
That, like,
I don't think she's that. I don't think she's that influential in the big picture. But I mean, she clearly had an effect, as did many of these people in that world. I mean, that younger caller from earlier clearly knew people as well as herself that were swayed by these individuals. So I do think they did have an effect on especially a certain generation. But I mean, I don't know. I see what you're saying. I just don't think. I think if anything, the responsibility is even more on them then, that they would put forth any sort of, like, here's an example using your Michael Brooks analogy, which I think was great in terms of helping me understand what your position was. I totally agree with that, except like what the equivalent would be like one of these YouTubers making a video about how, all Muslims are terrorists, and the equivalent would be someone saying that, all feminists are feminazis. You know what I mean? Like, there is no nuance, and I don't even know if nuance is the right word, because nuance makes it sound like, let's put it this way: the number of Muslims who are terrorists is very small. Just like the number of feminists who are like TERFs, probably very small as well. I mean, most people, I would assume, are not TERFs from my understanding. Now, whether they doesn't mean they have good views on transgender people. I think most people who have bad views on trans people are just uninformed and uneducated on the matter. Being a TERF to me is a whole different. Being a TERF to me is a whole different position, where you've done the research and you are steadfast against trans people, which to me is like the utmost disgustingness. Do you know what I mean?
Well, I mean, yes, I know what you mean. I'm not sure many people who would identify themselves as like people opposing trans rights on the grounds of feminism have necessarily like looked into it all that hard. Like I would say that like what you're saying is probably more accurate in the UK, where anti-trans sentiment tends to be something that is more like obviously a conservative, where like anti-trans feminism is something that is not as much held by, say, hold on, how do I put this? There's a lot of Mumsnet anti-trans sentiment in the UK, whereas like if it's here, it's either like a fascist, so to speak, or it's a by which I just mean Republican, or it's a or it's a TERF, and I don't really see many people who aren't right wing and aren't. Never mind. I'm gonna set this aside. I don't need to make this point. It's not important.
But I do think it's interesting that you obviously pointed out that there's a difference between like anti-trans right-wingers and TERFs. I mean, there is a difference in my estimation. I think there are probably a number of right-wingers who will end up coming around to trans people just like they came around to LGB people. You know, I'm not saying it's all, certainly not. There's a big portion of, I'm sure, who due to religious reasons or other, you know, the same groups that still don't accept gays and lesbians, and you know, they probably still won't. But I mean, TERFs are of a whole different variety where they that's their identity, to be anti-trans, to be excluding of trans people, to defiant, to know, to actually have, you know, looked into it and know what they're talking about, and then to defiantly come out and say, yeah, I get it, I am against it. I think that's you know, certainly, I'm not, you know, you as a you know, you're a trans woman, and obviously you obviously your feelings and opinions on this are much more, you know, valid in this sense than mine. But I do think in terms of just like me as someone who follows right-wing reactionary movements, I do think there's a difference there. Like, you know, a right-wing, now if a right-winger obviously you know, makes being anti-trans a part of their identity, then I could argue that they're probably also a TERF. But to me, just like, you know, not being into the idea of a trans person because you just don't know, and that's not really part of your identity, like it's just like something you haven't really thought about, and you just, you know, I don't think that's the same as a TERF. And that's not to say that there's that's they're a better person, or no, I'm saying that there's a difference in how you go about talking with those people, because I do think you probably, you know, eventually maybe we will bring some people around who are conservatives, just like you know, just like there's log cabin Republicans. You know, it'll be an issue that I'm sure there will be, as time goes on, a turnaround.
Yeah, possibly. I mean, like I'm not really gonna hold my breath on that. You know, I think that what will happen, likely you'll get some tokenism, like, you know, say the Andrew Sullivans of the world, or the Blair Whites, or Caitlyn Jenners, more than anything.
Right, it is an uphill battle. Trans people definitely face something, I think, that's going to be much harder. It has been much harder, in my estimation, than other similar groups. And I you know, it's tough. I appreciate the call. I was not expecting to talk about how anti-SJW, anti-feminist sentiments of the early to mid 2010s ended up really shaping a generation into today. But you and the previous caller, I had a great conversation with both of you about it, and I really appreciate it.
Can I say one thing before I go?
Absolutely.
Okay, so this is specifically directed at the previous caller, since she's also a trans woman. Hey, I know that you mentioned that you think of yourself as more of like, you know, as still having some libertarian in you because you still like guns and you still like drugs. But hey, just listen. If you go far enough left, you get your guns back. I promise. That's all I'm saying.
I like that. Pretty good. Thanks for the call. Really appreciate it. Sorry to hold you for so long. If you and the previous caller, we both had like almost 40-minute calls. But you know, great talking with you.
Great talking to you too.
Bye. I think that's it for today. This person just tried to call in. All right, last call. Absolute last call. Let me read a few super chats. We don't have too many super chats, so this will help. Samantha with a super chat. Whoever's calling is calling. Hey, what's your name? Where are you calling from?
Hey, Matt, can you hear me?
I can hear you. The reason I took your call, even though it's 1:20 in the morning, is because you're the person who tried to call in earlier, but there was some sort of tech difficulty. What's your name? Where are you calling from?
Hey, thank you. I'll make it super quick. My name's R.M. Brown. I'm a big fan. I want to tell you a really quick story. I have a YouTube channel. It's got like a little over 21,000 subscribers. Very influenced by you and Sam Cedar and guys like that. I had a situation Friday. I got a bunch of emails that that some entity called Corolla Digital put a bunch of flags on some videos I did about a guy named Adam Carolla, who's a conservative.
Oh, I know who Adam Carolla is.
I uploaded some videos because a while back he made a he had a rant where he was calling teachers in LA. I won't say it on your channel, but he was calling them the P word because they were worried about going back to class, in-person teaching.
You could say it on the channel. I want to make sure people know what Adam Carolla was saying. Go ahead.
Yeah, he was calling teachers pussies and cowards because they were.
I'm sorry. I don't allow the cowards word. I'm sorry. The pussies one is. Go ahead.
All right, I'm hanging up. But yeah. So and the teachers union in LA put a Twitter post making fun of him. They were like, "Hey, dude, you live in a $7 million mansion and you're calling us pussies. This is kind of a bad look." And I uploaded a video about it where I said the obvious thing, like, "Hey, dude, like you're only famous because Jimmy Kimmel gave you a help and all this crap." And so I uploaded 4 videos kind of making fun of Adam Carolla. Friday of this week, I got a bunch of takedown notices from they were initiated by an entity called Corolla Digital, which I'm assuming is Adam Carolla. I'm gonna assume that it looks like it. And I was thinking about it, like, this is a dude who testified in front of Congress about how free speech is being censored. He's got like literally like just hundreds of videos about free speech, and the dude didn't do like like email me or anything like that. They literally went in there and like flagged these fair use videos where I just played clips and made fun of him and stuff. And it was literally just to censor these, like, him being made fun of.
You have you had a commentary on it and everything, and it was just like short like clips from the show.
It's 100% fair use. Yes, like I played little short clips where he's like, where he's calling teachers pussies for that one. There's another one where he did an interview with Tucker Carlson where Tucker Carlson saying that he would have shot the dude who confronted him in that bait shop. Like, it's all the most obvious stuff. I uploaded videos like making fun, and it's all fair. It's all fair use.
Did you file a dispute with YouTube?
Yeah, like I'm going through the process with that right now, and if anybody doesn't know about like YouTube and like this situation, like it's very like YouTube doesn't have a great system for dealing with this. Like I'm going through it now, and it really is like they really don't want to deal with this kind of stuff, but it's 100% like they're abusing the copyright system because you're allowed to play a little clip of a video and then make fun of it. You're not allowed to just re-upload a video that's going to mess up their market,
Right.
But it's a totally different thing. It's like the definition of fair use. But yeah, like, and then Sam Cedar on the Majority Report, like somebody put an IM to him. They were like, you should talk to this dude because Adam Carolla is like going after his channel. And then Adam Carolla's fans started messaging people at the Majority Report to like not have me on and stuff like this. So it's just like, and I'm just realizing like how little these people are actually into freedom of speech. Like not at all. Like they hate it.
How has this affected your channel? Have you had things taken away from your features taken away, right?
So 2 videos were immediately taken down because it's called like, I guess like a copyright takedown notice.
Oh, so you didn't get a strike?
Well, 2 videos got taken down and I got 1 strike. And it really is. It is kind of a big deal.
Because you can't live
because
stream now, right?
I can still live stream. I did a live stream, but it kind of interrupted. I use Restream. I don't know if you use Restream.
I do, yeah.
Okay, yeah, I was using Restream, and somehow it messed up Restream, so I had to like go in and just like stream only on YouTube, like through YouTube and OBS. So it did kind of mess that up, but I'm still allowed to stream. But I had 1 strike for 2 videos, and then another video they were like, if you don't take this video down, you're gonna get a strike in 7 days. So I was like, all right, yeah, I guess I'll take this video down because I don't want 2 strikes. So yeah, it's just like it's a complete like self-own, because it's like, yeah, like I made fun of you in the most obvious way for calling teachers pussies, and like you're so like your feelings are so hurt by this that you're like going against this free speech thing by abusing the YouTube copyright claim system. It's just like it's truly bizarre. It's truly bizarre. I like was not expecting something like that.
Can you send me those videos?
Yeah, absolutely.
Because I would like to look into this. I think it seems like it should be fair use, and I would like to reach out to YouTube in my capacity as a journalist and find out what's going on here.
Yeah, totally. I downloaded all the videos. I'll send them to you.
Perfect. Listen, I obviously can't say that this is gonna fix it, but maybe it'll let them come to a decision quicker by realizing that there is a legitimate interest in a possible story. But I don't know. It's weird how they choose to. The funny thing is when people complain about YouTube takedowns. When YouTube takes down stuff for the reasons that people are saying they're being censored, it's usually just like, an automated system caught something, and then you just dispute it with YouTube, and within like 24 hours, YouTube looks at it and they fix it. If it wasn't supposed to happen, they'll fix it. If it was, then you should have been up and up on the policies. But none of these YouTube is censoring me people ever focus on the copyright issue, which is the ultimate problem. Like, there is no bigger issue with, like, if you're going to talk censorship on YouTube or online, period, like, I've had issues with YouTube solved really quickly. It's when a outside organization or business or whatever tried to claim ownership over something, sometimes incorrectly, too, stuff they didn't even own. I don't see any of these guys going out saying, I'm being censored. Like, they ignore the main problem altogether because, obviously they have a agenda, and the agenda is to, make big tech an enemy, which big tech could be the enemy, but, and is the enemy in some aspects, but not for the reasons that these guys are going after them for.
Yeah, exactly. I mean, and there's other issues with this. I think like, a good like mainstream YouTuber who's talked about this is H3, the dude from H3H3, is there are people who will who use this as like a ransom, like a blackmail thing, where they'll go and like file a copyright claim on a YouTube video, and then say, and YouTube is so sensitive about this stuff that they'll go along with it. They'll take down the video and they'll put a strike, and then the blackmailer will say, hey, like, give me $1,000 or $5,000 or whatever, and then I'll like remove I'll retract the thing. So like people are abusing the YouTube copyright thing like left and right. But yeah, you're right. Like the whole copyright thing in general is like, it just feels like YouTube is like just doesn't want to deal with it, and it's kind of a weird system that's like very ripe for abuse and stuff.
Right. I mean, it is. I mean, I've written stories about it in terms of how the copyright system has been abused. I mean, I had a company claim they owned content in a video of mine. I did the similar thing like you, but the issue was they weren't even the copyright holder. Like the actual company that it was for one of the Democratic debates. I did coverage of it, and the actual copyright holder didn't take any action. Some other company who had no right to do so but because they were approved by YouTube's system to claim copyright automatically because YouTube trusts them, I guess, because they're a big company, they were able to temporarily take my video down. And I reached out. I said, you do not own this. This was not even on your station. What are you talking about? And they reversed it. And then what happened, a different company right after the first company who didn't own the content reversed it, a second company who didn't own the content then issued a copyright on it. And I had to go through the whole process again. So you know, it's definitely an issue. The problem is that these companies are just deciding to issue blanket copyrights just so they could get the money from the monetization. And if they're wrong, I mean, they'll just reverse it if it comes down to it. But it makes more sense to them just to fucking say, I own this, I own this, I own this, I own this. And then, hell, maybe some of those people who don't know enough won't even complain, and they'll take some of the money that they don't even deserve. That's not even rightfully theirs. I mean, it's a fucked up system. YouTube has to do something about it for sure. I appreciate the call.
Yeah, no, absolutely. I just want to like really quick. There should be like some kind of penalty for doing a fake copyright claim, right? Like it should be like, dude, if you do this, we're gonna like your channel will get, the claimant's channel will be messed up if it's a false claim or something like that.
If you're part of that YouTube program where you can claim copyright and for people don't understand, there are entities who YouTube has approved to claim copyright, just like they have it in their back end, like their dashboard. Like they don't have to go to YouTube at all. They can literally, like, say I run Binder Entertainment Company, and YouTube gives me that ability, that feature. I can log into my back end on YouTube, and I can, without involving anybody else, just see a video and go, oh, that's using some of my content. Copyright claim, and just whatever I want. That should not be allowed. Like, with great power comes great responsibility. If you have that feature enabled and you are just flagrantly just copyright claiming everything, you lose that ability. Now, do mistakes happen? Sure. It should work similarly to how you and me have to deal with strikes, where if you copyright claim material that you have no ownership over 3 times, you're out. And we can even let these strikes expire after a 6-month period or whatever it is. No reason why it can't work for them like it works for us.
100%. Totally. Well, thanks for talking to me about this. I love you. Keep doing what you're doing. It's great. You're an inspiring dude. And I talk to you later.
Oh, I appreciate it. Don't forget to send me those videos, by the way.
I will. Talk to you later.
Peace.
Bye.
All right, folks. I'm hanging up the Skype. Hanging it up before anyone else calls. Skype is done. I'm reading these super chats, and then that is the show. Samantha with a super chat. Just got here and wanted to wish you well with NYC floods. Thank you, Samantha. Anastasia with a super chat. Great clear breakdown of ivermectin craze by Rebecca Watson. History of ivermectin, most educational I've seen. Until you saw this one, right? No, I'm joking. I'll have to check that Rebecca Watson video out. Thank you. Randy Randleson with a super chat. Great show today, Matt. Super interesting guest. Matthew Hanley with a super chat. Have thought about using Discord for calls. You can have a green room for people to wait in. Then you can bring them into a room with you. I have to get on top of that. People have wanted me to use Discord. I know. Miss Heathen with a super chat. Matt, thanks for taking my call. Just thought of someone for you to have on the show. I think Robert Evans would be great to discuss Afghanistan with. Duly noted. Kowalski with a super chat. Matt, so with the oceans rising, did you give an F? What? Huh? I'm confused. Super Platano Man with a super chat. Hello, my brother Samuel C. from the Bronx. Knows you from your punk days. Ah. Interesting. Kowalski with the super chat again. Doom till dawn. Let's go. More like doom till another minute, I would say. Mr. Saxokeet with a super chat. Our room Brown, says David Davy Boy Pacman. Is that how he pronounces RM Brown? Tim Bob Dunn with the super chat. Great show. I'm an RN, and maybe next week I can call in about anti-mask, anti-vax nurses. Thanks for staying up late for us on the West Coast. Left is best. Please do call in next week. I'd love to discuss that with you. Hachi with a super chat. Super nice talking to you, Matt. And if you are who I think you are, I apologize for keeping you on for so long, if, of course, you didn't want to be on for so long. See, this show is the opposite of, how we go on at Majority Report, where Sam is hanging up on you guys, and you guys want to go on longer. I'm forcing you guys to talk to me for as long as possible. No, because I actually truly enjoy being able to really flesh these conversations out on this show. There was one more comment that wasn't a super chat I wanted to read because I did see this and it was shocking to me. Uneasy says, "Hey Matt, did you see the malware attack on Western Digital cloud drives that caused them to factory reset? The forums are nuts. People saying, my life, my babies, my wedding pics, gone. Please help." I did see that. And as someone who just went through some data loss, I truly feel for those people. It's unbelievable. They didn't even, these could be like drives they just bought. I mean, I'm lucky this happened to me on a drive that was not holding all those photos. And I have definitely gone even super more anal about backing up. So hopefully in terms of me being like that will never happen. But I definitely feel for those people. Once again, patreon.com/Matt Binder. If you have not subscribed, I'd really appreciate any support on patreon.com/Matt Binder or youtube.com/Matt Binder. Subscribe there. That's full. You subscribe to YouTube for free. We're now 4.5 hours into this show. I am going to go relax. Folks, Tunbo Sun says that's why you have a backup of backups. Right. But if you have a lot of data, sometimes you don't realize what hasn't been backed up. Or in these people's cases, I mean, I don't think you'd ever assume that there'd be an attack like that on your data, especially if you're just a nobody with like family photos on a hard drive. But yes, always have backups of backups of backups. Folks, have a... Oh, wait, one more super chat just jumped in. SA says, "Brother Matt with the Lego hair, left is best." I don't have a Lego hair. My mohawk has the sides have grown too much. Cause see, this is how long the middle is, and this is how long the sides are. I need to reshave the sides. All right, folks, have a good night. Have a Matt the Machine Binder, people are saying now. Whew. I am a machine now, aren't I? 4.5 hours in, I'm just going on autopilot. Have a good night, everybody. See you all next time on Doomed.